Today, we are talking about innovative treatments for fertility over 40, red light therapy, PRP for ovarian rejuvenation, and more. This is for you if you feel like you're in a bit of a race against the clock and you want to get a feeling for the range of possibilities for boosting your fertility. We'll be touching on both high tech and low tech solutions and discussing how to decide what's worth pursuing for yourself. I'm Dr. Natalie Masson, and I'm a clinical psychologist and fertility coach specializing in the mind body connection. After having two children in my 40s, I decided I want to help others flip the script on the stressful and often pessimistic approach to fertility that we see so often. I have a special guest with me here today to help us out with this conversation, and I'm so excited to have him on board. This is Dr. Lorne Brown. He's a doctor of traditional Chinese medicine and director of the AcuBalance Wellness Center in Vancouver, Canada. He uses acupuncture and low-level laser therapy to help people get pregnant and also supports general health and wellness at his clinic. He's the host of the Conscious Fertility podcast, which features experts from around the world addressing the latest developments in fertility support. Dr. Lorne Brown, welcome. I'm so glad you're here with us.
I'm glad I'm here with you as well. And I really enjoyed having you on the Conscious Fertility podcast, which your listeners should know and go check it out. Episode number 82. It was awesome.
And I can't say enough great things about your podcast. I'm just going to promote your podcast for you because it's the thing that I would be creating if I was more organized and had more time. So I love that you're doing it because I can just kind of ride the coattails and refer people over your podcast. But I saw like the intro on your website and I just want to read it because it's so well written and really captures the essence of what you're doing.
I don't even remember what's there, so I'm looking forward to hearing what it says. It's been a while.
Okay, well, you can appreciate it here. Join Dr. Lorne Brown each week to learn how to put the mind back into mind-body to influence your body and autonomic nervous system and turn on and off genes for health, longevity, and peak fertility. If you're struggling to get pregnant, looking for simple tools to tap into the power of your subconscious mind and birth a life filled with joy, this is the show for you.
All right. Yeah, I remember when we wrote that. And the emphasis is on simple and mind body.
That is so perfect for our topic today because for those who are moving toward their later reproductive years, there can be so much pressure to learn everything and do everything, and the simplicity can go out the window very quickly. And I'm so excited to have you here for this discussion today because with your podcast, I see that you are having these deep conversations with such a wide range of practitioners dealing with medical approaches, energy approaches, emotional approaches. And so I feel like you have this really unique and valuable bird's eye view of such a wide range of topics that you've probably just like collected all these frameworks together in your head. And that's what I'm excited to pick your brain about. How does that sound to you?
Sounds good. Let's pick away.
Okay. I want to kind of start with a common jumping off point because a lot of people may be coming into watching this with all kinds of assumptions that they've gathered from their own appointments with fertility doctors, from reading on the internet, from the energy in forums. And there tends to be a sense of fear and doom and gloom around the number 4 when it starts your age, 40 something. And all of a sudden, there's sort of this sense that everything is going downhill. And if you don't go ultra fast and get there yesterday, all the chances are going away. And I really look at this from a perspective of the body's incredible capacity to thrive and regenerate and rejuvenate. And I believe that the research shows us lots of evidence that that is possible. So is that similar to how you're looking at things?
Yeah, well, one is my focus is always healthy baby, right? And that's what I know. The people that come see me, they really, at the end of the day, want a healthy baby. We often get attached to how that's going to happen, and I help create plans to meet their expectations or the how to. However, one thing I want to make clear is that the goal is healthy baby and then the healthy parent or healthy parents if there's two people in this relationship. And that can happen through natural conception. That can happen through an IVF with your own eggs. That can happen through donor eggs. And so the goal is always healthy baby, period. And then the how to comes later. So when you say 40, yeah, women are having babies at 40 and even at 50. The ones at 50 are using donor eggs, mind you, but they're having their families that they wanted to have. So the focus is always healthy baby and healthy parent. When it comes to at 40, like you talked about on the internet, there's two extremes that I see. One is ignore age and it doesn't matter, right? And the other one is doom and gloom. You're 35, the switch is on, right? You're done. And so they're both myths and they're both kind of incorrect. So women at 40 can conceive. So we know that. And women at 41, 42, 43, the science or that current data shares with us that the risk or is less to get that conception. So may take longer and you may need some support. So when I see somebody coming to me at 40 or 42 or 43, there's no real value of talking about age-related fertility and what you could have done when you're 30, 35. They're coming to me at 43 because maybe they found love late, or for whatever reason, this is when it's timing for them to get pregnant. If they're not aware, just to set expectations, we let them know that with age, your fertility does decline. It's just a real fact. To put this into another perspective, some people may think or feel they should live to 200, but it doesn't happen, right? There is a lifespan.
Darn.
Yeah, there's a
Burst
lifespan.
my bubble.
There's a lifespan to the human body, and there is a biological reproductive lifespan. And in Chinese medicine, we have this idea of understanding when this ends, and Western medicine has data when it ends. And so if somebody's coming to me at 43 is, what can you do to increase your chances of that healthy baby, right? What's available to you? Because you're going to be trying anyhow. And what are all the options? So a lot of the women I see, because I don't have a financial interest in the IVF clinic that I work with in our city, that we go on site and do IVF acupuncture with one of the local IVF clinics. When somebody goes through an IVF or a donor egg, there is no financial benefit to me or my clinic. We don't share in that IVF fees. So they like that conversation if I actually share that the odds are donor egg may be your best chance. At least I'm not pushing them into it. I'm just letting them know what's available to them. And I let them know what's available to them because my goal, which is their goal, is they want to have a healthy baby. And so to answer your question, at age 40, yes, women can have babies at age 40, 41, 42. There's women having babies at 45. And to not be delusional, we do know that the healthy eggs, so this is the data that's been collected, say at 35, 60% of them are considered euploid, like normal eggs. And then by 40, rather than 60 normal, 40 not, it flips. So on average, 40 are normal and 60 are not. And then maybe by 42, it's only 20%. But that means there's women still getting pregnant. It just may take a little bit longer to get that normal egg to ovulate, or an IVF to choose that normal egg. And that's the expectation part, not to think just because I'm healthy, I eat well, I do these things, I should get pregnant. There is a biological reproductive clock in the human body right now that we have not figured out how to tap into or unlock to expand it. And I say that because remember, I don't remember the name, but remember the 3 minute, I think it's a 3 or 4 minute mile. It wasn't broken for eons, and it was thought it was human impossible to break it. And then eventually one person broke it. I can't remember what year that was, but they broke the 4 minute mile. And then 3 weeks later, the next person broke that 4 minute mile. And now many people do it. So I share with you that can we get pregnant later in life, 50, 60, with our own eggs? Maybe. We just haven't figured out how to unlock that yet. And that's why you and I are so curious with the mind part, because the mind is the greatest pharmacy in the world. And when you're looking for miracles, I've just seen miracles where things don't make sense on a materialistic world, where these miracles happen because we can't explain them with our modern science or modern understanding. You're that outlier. So I think there's things that technology will discover and things that we will learn that we can do to probably maybe expand that. For us right now, at the time of this recording, there's a lot of things available naturally and in interventions in the Western medical world that can increase your chances of conceiving with your own eggs. And there's also something that exists now, donor eggs, that 50 or 60 years ago was not available, that allow people to still be parents.
Yeah, and I appreciate your mention of the 4-minute mile
Mhm.
and how just seeing that something is possible can make it more possible for others. And when you invited me to share my story on your podcast, I said, of course, I'm happy to share my story because I can, in some ways, be a poster child for mid-40s natural conception. I don't know that 20% of my eggs or 1% were good. All I know is that I did get a good egg. So, what percentage was it? And what I'm very curious about now is when someone comes to me at whatever age they are, my reaction is, I don't know what percentage chance you as an individual have. Sure, we can look at
Mhm.
population-wide data, but I don't know your individual chances. And what I really want to know is what might be worth adding to your regimen that can boost you from where you are right now. And
Yeah.
I find that that's what most people are interested in when they're coming for help. They don't really want um, population-wide statistics on their personal chances. They want to know what what is possible for improving from where they are. And then they're going to decide what kind of, risk reward ratio they want to expose themselves to. So, what
Yeah.
I'm hoping we can do today is step through the
Mhm.
variety of things that we've been hearing out there. And some of these you've learned a lot in depth through your own work, through your conversations with your podcast guests.
Mhm.
And I'd like to hear your hot take on each of these things and how you think about navigating them. So before we go into it, I'm going to run through the hit list we're
Okay.
going to do so people, our listeners, can get a sense of what's in store. But we're going to touch on red light therapy or photobiomodulation, PRP for ovarian rejuvenation, low level stimulation for IVF, low level ovulation stimulation.
Mhm.
Uh, I've heard about stem cell therapies, epigenetic therapies. There are many supplements that people are using in their regimen. And then we have the standard things for healthy living and a few more specifics we're going to touch on related to specific diets, especially. So that's kind of what we're looking ahead at. Before we get into your reactions, and I'll share mine too about each of
Yeah.
these areas, um, I would like to invite you because you've shared with me before that you have a framework for thinking about all of these things instead of there's 101 things out there. You have a framework for how you recommend people approach looking at all the options. Would you like to share that?
Yeah, I'd like to talk about the framework. And also, you mentioned we'll get into like the lifestyle, like diet and lifestyle. I just want to share that often it's these small actions that lead to big results. And so we're going to talk about some really high tech stuff, PRP, you mentioned, photobiomodulation, these things, diet, lifestyle. It's an assumption that you're moving, eating, stress reduction. Like these high tech uh, interventions often can override a poor lifestyle. So um, don't dismiss that. And because if we run out of time, I just got to say, like, we often get excited about the most expensive, shiny technology out there, but small actions daily lead to massive results. Okay, so I just wanted to share that. So going back to the framework, because I love simple, and my framework comes from my background. Before a doctor of Chinese medicine, I used to be CPA, so a chartered professional accountant, and we used to always we're trained to ignore the red herrings. Like there's a lot of things that will take you off what you're trying to do, lots of red herrings, and come up with a framework so you can stay focused when you're doing your audit, or the whole accounting aspect that I was trained in. And so that part of my brain is developed, and it came with my fertility because there's so many things that are out there, so many red herrings. And I was like, okay, I got to find a framework to help me filter through whether somebody should be taking this supplement. Should we add one more supplement? Should we be doing this diet? And so it's just the way I like to think about things. And it seems to be received well with my patients when I create like a plan for them. And so if I may, my framework comes from the Chinese proverb of nourish the soil before you plant the seed. And and that's a really cool proverb when it comes to fertility, because when you think about a plant, for example, that you've neglected, and it looks a little withered and dry, rather than composting it, often by just watering it, pulling out some weeds, giving it some fertilizer, if it's an indoor plant, moving how much sun it gets, it can regain its vigor and give off fruits and flowers. So this plant always had the potential to give off fruits and flowers. But because the soil was suboptimal, it could not reach that potential. We did not do donor roots, right? The roots were the same. It was playing with the soil that allowed this plant to reach its potential. Well, in this metaphor, the plant is like the egg cell, or sperm cell, and the soil is your cellular environment. And so the same thing, if your cellular environment is off, then your egg cell may not reach its peak fertility potential at the time of ovulation or at the time of an egg retrieval. And if you're doing a frozen embryo transfer, or naturally the embryo is coming down the tube and it's landing in the uterus around day 5 or 6, or you have a frozen transfer, which would have been age of the embryos around day 5 or 6, those cells, that uterine receptivity, right? If the soil's off, now that metaphor really works now, the soil to receive that seed for it to implant. So when I look at all the things out there, I'm always looking at what can impact the soil from a cellular environment perspective. And so we know the soil, like in a plant, it could have a microbiome issue. Well, we could have a microbiome issue. So our gut could be off, poor gut microbiome. There's lots of talk about the uterine microbiome now. And just so you know, your oral microbiome will impact your gut microbiome, because we believe that it's systems based in Chinese medicine and functional medicine. So your gut and oral microbiome could impact your vaginal and uterine microbiome, right? And we know the gut microbiome impacts inflammation. It impacts cardiovascular disease, metabolic disorders. So metabolic disorders, think extreme ones like polycystic ovarian syndrome, autoimmune conditions. So that microbiome is really important. The plant, we talked about the soil, it was dry, it didn't have any water, right? Well, in the human body, on that cellular environment, that's blood flow. And we talked about 40. Well, as women age, the blood flow to the reproductive system decreases. So anything that can increase blood flow to the reproductive system could be beneficial. That's why acupuncture became popular, because it's great for increasing blood flow. We know low-level laser therapy, depending on where you place the laser, can increase blood flow. Stress reduction indirectly increases blood flow, because when you're stressed, blood is diverted from reproduction and digestion to go into that survival mode, fight or flight. And if you can elicit the relaxation response and go into parasympathetic several times a day, that parasympathetic nervous system is known as the rest and digest, also breed and feed nervous system, emphasize on breed, then the blood will come back to the digestion and reproduction. So I always look at the soil, like if it does, fertilizer, if there's not enough phosphorus or nitrogens or other things in the soil, the plant will thrive. And, you could have great oranges, but maybe they won't be full of vitamin C because they weren't able to pull it up through the soil and do what they do to create that vitamin C. Well, if your cellular environment is nutrient depleted because of your diet, or because you have a poor gut that can't absorb it, or you eat as I mentioned, poor diet, then the cell may not get all the nutrients it needs. So that's why when we hear about omega-3s can help with fertility. It can help with brain health. It can help with skin. I remember a physician once said, this was crazy. How can an essential fatty acid treat so many things, right? And I said, well, you're thinking of it like a drug. It's
Mhm.
not that it treats all those things. It's that if your body's deficient in the omega-3s, then all these things can happen. It falls apart and these symptoms show up. So if you give the body what it needs, then it can do its inner healing and none of these symptoms show up. So it's not like a drug that it's treating. It's like we're giving the plant, the soil, water, and then the plant pulls up the water and does what it needs with it. Mitochondrial health for people that once we get older, over 35 in the 40s, the current theory is mitochondrial health. The mitochondria of your cells, they're the batteries of the cells. And it comes through the female to the embryo, the mitochondria. And so that early division after, so your eggs are all dormant. You know, you've probably all heard the story. You've had all your eggs since birth. They're kind of dormant. Then meiosis starts again, closer to ovulation or during that IVF process. And that takes energy for the chromosomes to separate. So, you know, you only have half, so the sperm can come and join. So that takes energy. That's the mitochondria. Then the embryo, to when it divides, whether it's dividing in a fallopian tube over those 5 to 6 days or in the IVF lab, that takes a lot of energy. So that's from the female mitochondria. And then implantation takes a lot of energy. That's from the mitochondria. So mitochondrial dysfunction could be a reason why we're having egg quality issues or embryo quality issues. So what can you do in the soil to support mitochondria? Well, first, things that damage it: smoking, excessive stress, poor lifestyle, lack of exercise, lack of sleep. And then so many people know CoQ10 now is a supplement for mitochondrial health. And photobiomodulation has been shown to improve mitochondrial health, as has acupuncture and many other things that you can do. And there's lots of things you can do. It's just, you don't need to do them all. There's a cost benefit. So when we look at the soil and somebody says, should I do this? I'm either seeing, is there based on age or based on their signs and symptoms through my history taking? Do we suspect this is what's out of balance? Are they nutritional deficient? Do they have too much inflammation? Where's the inflammation coming from? Is it a stress response, you know, from old trauma? Is it from smoking or poor health environment? Where is the inflammation coming from? Is there a hormonal balance? Do we see a lot of PMS, menstrual pain, clots, or spotting irregular cycles? Obvious signs of hormonal imbalance from a Chinese medicine's perspective. So I'm looking at the soil based on this, what the plant looks like. And then that lets me know what I think may be off. And then we start to choose certain interventions that will support the soil so your egg cell and his sperm cell can reach their peak fertility potential at the time of ovulation or IVF retrieval.
Okay, so if I were to summarize, thank you for that detailed explanation. If I were to summarize using your language, um, when you're looking at everything in a holistic, whole person, whole system
Yeah.
view, and your metaphor is soil. You want the soil to be rich, to allow energy to come into the system, and circulation, nourishment and circulation and reducing inflammation are three things that I heard you mention
Right.
that are kind of key to helping the system thrive and have enough energy and mitochondrial power to lead to good cellular development. Is that a good
Yeah, and there's because
view?
what's going to affect the health of this plant or this egg cell, right? And so, like you said, circulation, things could be interfering. You could have weeds, so we got to pull out the weeds. Weeds are too many plastics. Weeds could be your smoking, excessive drinking. You could have inflammation. So we're looking hormonal imbalances. So again, when we look at the soil, pH could be off, microbiomes could be off. There could be weeds, contaminants. So, you know, it doesn't matter how much blood flow you're watering. If the plant has a bunch of crazy rocks and contaminated oil, soil, and weeds, you got to pull those away because it's still not going to survive, even if you're giving it all the right nourishment. So,
Yeah.
yes, that the idea is to and to give the concept of, you talked about the systems based, this holistic approach. currently, and it's changing, allopathic medicine kind of treats it like a machine, that everything is separate. It's probably a weakness, an Achilles heel in Western medicine, because we are not separate parts. There are systems and they communicate with each other. So, I mean, they know this, it's obvious. If a man has erectile dysfunction, it's a sign to check for cardiovascular disease. Right? So the heart and penis, there's a relationship there, which is why so many supplements on the market, you'll notice, that we use for fertility, erectile dysfunction, are also good for the heart. Funny
Interesting.
enough, right?
And I think it's, oh, go ahead.
But so I was just going to share that it's a systems base and everything is connected. And so we're looking where Western medicine, their job, and it's a difficult job. My hat's off to allopathic conventional doctors, because they got to override your body and try to mimic what your body would do. Major task. My job, my approach is it's easier. It's easier because I just give the body what it needs, knowing that it has an innate ability to heal, and allow it to do what it needs to do. When the plant receives the sun, the plant takes that energy and converts it at photosynthesis, right? And creates the energy. So we're not trying to tell the plant what to do with the sun. We just want to make sure the sun gets this, the plant gets the sunlight. And so same thing with the laser. I can put photons into the body, but the cell has to be able to receive it and do its job. And so we're just creating an environment. So in this case, soil is cellular environment. So the cell has what it needs so it can thrive. And if it's functioning well, the mitochondria are functioning well, then it's going to absorb nutrients better, right? If it's not functioning well, even though you're eating well, taking supplements, it may not be absorbing the nutrients, or you're building up waste and you can't eliminate the waste, and things can get blocked up on many pathways. So that you summarized it well. It's systems based. And the key thing is, we're just creating an environment so your body can thrive to reach its healthy potential, in this case, fertility potential.
There are so many things that you're saying that I want to follow up on. I promise our viewers that we're going to get to the specific topics that we talked about, but because I just really love geeking out about this stuff with somebody who is like-minded, I want to highlight how your backgrounds influence how you look at things. So you have the accounting background where you're very keen to numbers, and you're also trying to stay focused and not get distracted by a bunch of details, because in accounting there's all kinds of details that you know would be irrelevant, you could get distracted by. And in Chinese medicine, you're very much looking at the system as a whole, and how do you support the body to do what it does best. And my background before I went into psychology was engineering, and my strength was looking at systems, like looking at the big picture of how does everything, that Venn diagram, how does everything fit together and work together? And that's how I looked at things as a psychologist. And when I'm looking at mind body health, same, I'm looking at what does the whole system do with itself? And like you're saying, in Western medicine, there's a reductionistic approach where you're breaking down into all the systems of the body. So, the endocrinologist is going to go deep into this area, and the cardiologist is going deep into that area. And sometimes it's like what I can't remember the metaphor, but the blind men touching an elephant and nobody knows who's where, but they feel all different things. That's a team of deep specialists in Western medicine sometimes will miss the big picture because they're each looking at their tiny little sliver deeply. And that happens often with breathing imbalances. So the way we breathe affects all the systems of the body. And so often people go for neurology and cardiology and all these different areas because the breathing is off, but nobody gets that because they're looking at other specifics. So I think we're coming to this from our different styles of training, but with this holistic approach. And the way I describe the framework is very similar, slightly different words, but I describe the framework as we want to boost circulation, move the blood through the body, since blood is carrying oxygen, and that is going to nourish the cells and bring them power. We need to put good nourishment through food and other energetic things that we do, our relationships, our thoughts, our emotions. those are all nourishing the system as well and giving it power. And the guiding principle I come back to is what can boost my overall natural energy that my body carries with it. And so when I look at all these different methodologies, I'm going, how does that help replenish, boost, restore, support the system's energy? And I think we're talking about the same things. And
Yeah.
reducing inflammation is in there too. Like what's getting in the way, what's blocking, what's stealing energy,
Yeah.
what's sucking energy away, and where are we missing opportunities to put energy in? So I
So
think we're talking about the
we're
same things, like
talking
we
we're
arrive at
talking the
similar
same.
conclusions.
Just different metaphors or languaging, and they're both important, the reductionist perspective and the holistic big picture. So it's a yin yang perspective. And then to tie in why we also resonate so well is I'm also trained as a clinical hypnotherapist. So the mind part is so important because in that soil, we talked about you could have hormonal imbalances. Well, guess what? Your thoughts and feelings over time, if they're very stressful, perceived stressful, will cause hormonal imbalances through the increase in cortisol, all these adrenaline hormones, which lead to inflammation, blood sugar dysregulation, and then they trickle down. We have hormonal imbalances. If your mind's off, you can have, like we talked about, lack of blood flow. We now know that stress, chronic stress, again, perceived stress, it's not so much the stressor, will impact your gut microbiome. So we talk about the gut microbiome. And so the mind to me is probably the least managed in our fields today. At this time, we go right to the body, and there's a top down, bottom up approach. So the body impacts your mental, emotional, your physical health, and your mental, emotional impacts your physical. And we've gotten pretty good at doing all the things for our physical. We know about a lot of these things, but we're ignoring the mental. Like, people who are listening to this, I know what you put into your mouth, you're very careful, but what you put into what you hear and see, like the news and your scrolling and all that, are you really careful with that? Right. So I think what you're doing is really important. And what I do in my practice, my emphasis is on the subconscious and on the mind, because there's a trickle down effect. And when that mind heals, the mind heart relationship heals, your behaviors are always congruent with the programs. So often we can self-sabotage ourselves unconsciously. And when you clean up your thinking and your subconscious, because your behaviors and actions are always congruent, then your behaviors will start to trickle down from this new belief system, and you'll do the right behaviors. Or right's not the correct word. You'll do behaviors that support health.
Mhm.
So anyways, we went on a little tangent there.
You're speaking my language.
Yeah.
We could do many episodes on all of this.
But both are important. The
Yeah,
reductionist and the
yeah, yeah.
expensive. It's not like, because that's what we like to do. Oh, so Western medicine's bad. I did not say that. The reductionist, if you're in a car accident, life saving, if I have a kidney I've had a patient come into me just with a kidney infection. She knew she had a kidney infection. Her back hurt to touch. And she came to me saying, I don't want to take antibiotics. Right. And I said, well, you should take antibiotics. She goes, but I don't like antibiotics. I go, I would like you to do the antibiotics to clear up your kidney infection so you live a few more days, so then we can do the natural probiotic to support your body after. But Western medicine is a good urgent emergency medicine. And then when it comes to fertility, there are things that they can do that the holistic approach isn't going to correct, for example, right? So it's not this or that, it's integration. And if you can pull and use from both worlds, there's a lot of power in that. And thinking about the IVF, one of the reproductive endocrinologists I had interviewed used the term, the IVF, they use the building blocks of the egg and sperm, garbage in, garbage out. So she encourages the people she sees to change the diet, look at supplements, look at acupuncture, do the things that you can to optimize egg and sperm quality for those 100 days before the IVF to give your IVF a better chance, right? So
Yeah.
so there it is. The person needed IVF. However, let's see if we can enhance the success of IVF through doing the stuff that you do have agency over.
Yeah, and I think that's what we're trying to spread the word on, is being knowledgeable about the breadth of options and then wise about how to choose among them. And it's
Yeah.
not about being in a camp of Western versus Eastern, natural versus intervention. It's about what's going to help you the most. And
Healthy
there's no
baby.
point in
Health-
taking sides. It's about what's going to help your side get you the result that you want. That's how I look at it.
Yeah, and we focus on healthy baby, healthy parent or parents. And so that is part of that framework that we look at. Is this going to help us have a baby? Is this going to help us baby be best chance for baby's health, best chance for parents' health?
Okay, so with that framework, we're nourishing the soil, we're boosting circulation, we're energizing the body. Let's look at some of the newer technologies that are out there. And I want to get your sense from your work with patients, from your conversations with your podcast guests. Um, Red light therapy, photobiomodulation. So this is about using a certain wavelength of light, shining it on the body. It stimulates activity in the body to help with all kinds of things. It's used for many health conditions, and it's anti-aging, and we've been using it for fertility too. What is your sense of how this plays into the picture?
So again, from the soil's perspective, and then we'll talk a little bit more about it. So photobiomodulation is probably the most accurate word. Second accurate would be low-level laser therapy, but not all systems are using lasers. Some are using LEDs. Hence, photobiomodulation is what the scientific community uses. Red light therapy is a certain wavelength, and there's many different wavelengths. So photobiomodulation is the term I'll use, or low-level laser therapy. Um, the soil. So what do we want to do with the soil? Well, remember the sunlight, the plant receives the sun and turns that photosynthesis turns that into energy. Well, our cells absorb red and infrared light, and that improves mitochondrial function and increases ATP, the energy currency of the cell. So that's one of the mechanisms we like about it. Remember, we want to increase blood flow and circulation. Well, low-level laser therapy will increase blood flow and in circulation. Um, we talked about the gut microbiome. Well, there was a study done on Parkinson's disease, and there's a link between the gut microbiome, because it can create inflammation that impacts the brain, and Parkinson's disease. So there's a study using low-level laser therapy, photobiomodulation, on the gut and in the midbrain, and they showed that it improved Parkinson's symptoms. So there was an improvement. And in this study, they did DNA sequencing of the gut microbiome before and after, and they could see that it changed the ratio of good to bad bacteria in the microbiome. Metabolic disorders, blood sugar issues, hormonal imbalances are an issue. Being in that stress state is an issue all the time, being in sympathetic. So using red light therapy, as you talked about it, but photobiomodulation and low-level laser therapy on certain parts of the body. So it's not like if you stand in front of a red light, I don't know if it would do this, but using probes on certain areas with a certain dosage, the mechanism has shown that it can engage the parasympathetic nervous system, right? So hence part of that blood flow and putting you into that more of that relaxed state. It's been shown to help regulate blood sugar, right? So there's that. So when we look at photobiomodulation, we get and soft and scar tissue adhesions. People have had surgeries, secondary, trying to get pregnant, and you've had a C-section. So there could be adhesions. You could have had endometriosis. Oh, inflammation. I didn't mention that one. Inflammation. I often call it inflammaging, as in inflammations when you have chronic systemic inflammation, which leads to accelerated biological aging, which leads to degenerative diseases, premature degenerative diseases, and fertility decline. And so photobiomodulation regulates inflammation, regulates the immune system. So the mechanism's awesome. The data in clinic is not robust yet. So we don't have, things that work in the petri dish and in mice don't always work in humans. But the mechanism is really exciting. Like, blood flow, mitochondria, microbiome, inflammation, parasympathetic nervous system. I mean, it really can impact your soil. What data do we have? Well, there's some case study data. Anne-Marie Jensen, and if you listen to, it's episode 78 on my Conscious Fertility podcast with Anne-Marie Jensen. She's out in Copenhagen. She has well over 200 case studies she reported. Her success rates are fairly high, optimistic. And she uses a certain system where they come in 3 times a week in the follicular, so 6 times a cycle over 3 to 4 cycles. She's shown pretty good results. There was a study done on mice where they take the mice and they do an incision and pull out the ovary and laser one of the ovaries, not both, then put the ovary back in, do the incision, suture the mouse, and then they do an IVF, and they looked at progesterone levels, embryo quality, AMH levels. They looked at all these biomarkers and embryo quality, and the side that got lasered had all the better markers compared to the side that didn't. The whole photobiomodulation was just kind of discovered by an accident, because it was originally used for skin issues, so wounds not healing, and then it got more popular into injuries, because it can accelerate healing right through cellular proliferation. So a lot of injuries. Now, I was just at a conference at the time of this recording where I got to speak about photobiomodulation for fertility, but they were using it on so many things. Research on it is pretty amazing, from sports enhancement, injuries, eye issues, brain issues. So again, the mechanism is quite exciting. But the accident was a medical doctor in Japan, Dr. Oshiro. He's a pain specialist, and he was treating a woman that was already in menopause for back pain. And he had this approach where he would treat up around her carotid and the brainstem and stellate ganglia, and a point in the celiac plexus in the abdomen, because that would engage the parasympathetic nervous system, which would make blood flow go head to toe. And he did this because whether you had back pain, knee pain, or elbow pain, he wanted blood to go to the area, because Natalie, as you share, circulation, bringing blood to the area will help with the healing. And then he locally treated her back with the photobiomodulation. And he did a series of treatments. I don't know, it was 20 some odd treatments, and her back pain went away. But her cycle came back, and she started menstruating once a month for several months. He dismissed it, thinking it didn't have anything to do with what he was doing, and suggested she see her gynecologist because she hadn't been bleeding, and now she's bleeding again. Make sure there's nothing serious. In the same calendar year, another woman in menopause with back pain, her period came back after he treated and resolved her back pain. So then he thought, oh, we must be rejuvenating the ovaries by bringing more blood flow to it. I personally think what was happening is blood flow, but he was regulating inflammation as well, and probably the microbiome, because where he put it. So I think that's probably one of the reasons. There's many mechanisms that might have helped. And they took a demographic that the English translation was severe infertility. That's the definition of what they used. They looked at about 74 women. I'm going by memory here. I think the average age was 39, maybe 9 years of infertility, 15 years of 15 ART cycles. And they showed over a 20% pregnancy rate and like a 68% live birth rate. So they expanded the study, and they to 700 women, and again 23% pregnant and 50% live birth rate. So that's kind of how it kind of started. There's another clinic, Nakamura in Japan. His data pre-COVID was over 10 years of data, and he had shown that when he did at least 3 cycles twice a week doing acupuncture and photobiomodulation, they were doubling blastocyst rate. So how many embryos would make it to day 5?
So is it fair to say that there's enough data that you feel compelled?
Yes.
I'm jumping ahead a little because you've invested in
I invested a
low-level
lot of
laser
money.
technology in your clinic. You saw this research and you said, I want to bring this to my patients. And you spent a lot of money on high-powered lasers for your clinic.
They're low-powered. I spent a lot of money on high quality, but they're low power. They're not the ones that,
low-level lasers for your clinic that you've been using.
Because the mechanism excited me, and I saw some of the data that was being shared, and I wanna help people get success. Like, I'm a practitioner, and I get excited when we have the success too, right? And I saw this made sense. So yes, there's really inexpensive systems on the market. I can't know whether they work because nobody's done a study on them. I do know at the conference they did share that I think it was close to 50% of the systems on the market that people are buying, home systems, don't do what they say on the website, as in they test to look to see how many photons are coming out, like the power and what they're doing, the wavelengths, and they're not accurate. I have a device that can measure photons, so I put all my systems through, And I have one of the systems that's quite popular that people are buying, and that was the only one that didn't measure any photons. So I invested in ones that I knew were high quality, so they were expensive. And the reason being, though, is just the mechanism excited me, right?
So can you give us a sense of, because I've dug into those studies that you've talked about too, and I kind of parsed out, what were their success rates by age range. I'm really curious though, what's your anecdotal impression from in your clinic of using it? How much boost do you think, particularly for our 40 and up cohort, how much boost in um, outcomes
Yeah.
do you
So
see?
I share with patients, it's not a magic bullet. Like everybody wants the magic bullet. It's that holistic approach. What's your diet like? What supplements you're taking? What's your sleep like? It's just another thing that's going to support the soil, right? And so it does help. And as we see, like all the interventions out there, and this is the unfortunate news, is most people that are between 30 and 40 benefit the most. And then once we get over 40, these interventions will help them. But again, they don't get as much benefit as the other one. So but what are your options, right? And so,
Right. No, but that's helpful to know that's
yeah,
what, because I think just like you were saying at the beginning, you don't want to be delusional and send people off with, dream it and it can happen. Everything is possible if you believe. Okay, that's not actually serving people to go that
no,
far. So what you're seeing in your clinic is you see more obvious, you're seeing higher rates of positive response, 30 to 40. You believe it's helpful 40 plus, but in this range, you're wanting to bring in more things, more
and I'll,
different things, and
and I'll
it's not a
just
magic bullet.
and I just because sometimes when we take it out of the fertility, it's easier to land. If I sprain my ankle at 25 and I sprain my ankle at 65, it heals quicker and better at 25 than in my 60s, right? So we do peak. That's why my grandfather, he's not alive now, but I seen pictures of him in his 40s or 50s, and he died in his 90s. He did not look the same, right? Like things changed. So you're made up of trillions of cells. So as I get a little puffier and a little wrinklier, that's made up of cells. So we're not going to live forever, unfortunately, or maybe some people say, thank God, right? Depends what you think of your life. And currently we don't reproduce forever. The physical body, I believe there's more to the body than the physical. So I do think there's an internal component to us. But when it comes to fertility, we want to do whatever we can to support them. So for these people over 40, they don't get, the success rate is lower for somebody 43 doing all the things we recommend that has egg quality issues than 33 that has egg quality issues. It's just what we notice and observe. So what do they do? Well, if you're going to continue to try natural or go to an IVF, go in with your best chance, right? I have
Yeah.
a family member, for example, diagnosed with Parkinson's in his late 70s. He's in his early 80s now. So he uses the laser on the gut. I got him the headset as well. He's taking a few supplements. He's got an exercise program because it's really been shown the exercise for Parkinson's. So we have a few, and his diet, we got his on a good diet. And they really show that the progression is slowing. He's still got Parkinson's and it will progress, but they're pretty impressed at his age, how he's doing. He feels pretty good. He's doing the best he can because he's got this condition that we don't currently have a cure for, right? But what can he do to maximize the remaining years he has in his life?
Okay, so I have to share a personal vignette also. So my mother is 82 years old and she has vascular dementia,
Mhm.
um, diagnosed about 2 years ago. And so I got her the red light headset as well.
The
That
V
was,
Light one, the V Light one. Which one did you
yes,
get? Yeah,
yes.
that's what
That's
yeah,
one
I
you
like
have?
the V. Yeah, I
Oh,
got
amazing.
that.
So this one has a version. That's it.
I use it. I do it 3 times a week so I can stay sharp.
Okay, we are true photobiomodulation geeks, getting all of our relatives on board with this because obviously I'm revealing here, I believe that there's a lot of potential for this technology too, based on reading all those different studies. And so the one that we have also has a laser that you clip onto your nostril and it goes up your nose. Do you have that
Yep.
one?
Yeah, well, the V-Light, the head one, I'll do that, yeah.
Yeah. So here's what happened with my mom. We've been tracking very closely because she also has type 2 diabetes and high blood pressure. So we track every day her blood sugar and her blood pressure. And when I finally convinced them to start using this contraption, within a day, both her glucose levels and her blood pressure came down and stayed down to where we had to go back to the doctor and say, hey, we need to come off of some of the medication. So we reduced her insulin, reduced her blood pressure medication. So that is an anecdotal data point of it does something. This is not just, somebody's scamming us with these
Yeah, well,
devices. Something
the
is really happening in the body with the
the
light
the mech
therapy.
and the mechanisms there, like I have the Weber watch, so that goes on the wrist, so it radiates the blood and can go up and goes up the nose on both sides. I have many toys. I like my toys. A thing to mention though is like, oh, so I'm going to go buy this system, this system. You still need to create a biological effect. And so that's where I'm always looking into the systems and where you place it. So standing in front of a red light screen, I don't know if that will do enough for fertility, right? It may help a little bit on for the systemic inflammation. Most people, when you read their devices that they're selling, they're quoting research on other systems. And so that doesn't mean their system will work. It just because they're quoting, for that Oshiro did for the blood flow, he did points around the carotid, which I also think he got the vagus nerve, which would probably help, statellite ganglia, and he did the celiac plexus. Somebody else, I just actually had him visit my clinic from Germany, Volkmar Kressel. He did a study using a sweep, so changing the wavelength over the not the wavelength, the frequency over the celiac plexus, REN 12 for my acupuncture colleagues, that area. And he was able to get a parasympathetic response or not based on how he did it. So it didn't always work. So he played with dosage and frequency of the hertz of the laser. So just getting red light doesn't mean it's going to do anything. If it does, it could be too weak. So there's no biological effect. It's just not enough. There aren't Schultz law. You may not have enough of it, or you can overstimulate, where you could actually turn things off. Like if you have a superficial wound, you can slow down the healing if you give too much dosage. The good news is the Goldilocks dosage is quite generous, so it's hard to overdo it. And when it comes to fertility, the ovaries are so deep, it's really hard because it's really hard to get a therapeutic dose of photons to the ovaries. However, what we don't know, think based on the mechanism, is that a cascade of events happen when we put photons into the body in certain parts of the body. They create a cascade of events that eventually reach the ovaries, have an impact, like the blood flow, like immune regulation, like regulating inflammation. And we now know a whole new quantum biology, because this is all about light reaching the cell, the chromophore, cytochrome C, which absorbs the light and converts it into energy. It also causes a nitric oxide vasodilation. That's why I like the nose. They've used it for COVID, by the way. That was one of the studies I saw at the conference. But vasodilation. So when you, what was my point I wanted to make with they show now that not only it used to be the cell had to receive the light to have a biological effect. Now they're showing that when you put light into the body, our cells give off photons all the time as well also. So we're light beings. We really are light beings. We give off photons. And now they're showing that when you hit the cells with light, they in turn send out other wavelengths of light. And when I asked the expert on this, I go, what does that mean? He goes, well, it's quantum biology. We don't know exactly, but we're kind of like, this is crazy exciting, because most of the stuff we've been studying is on a biochemical level. We do this, nitric oxides releases the nitric oxide from the heme molecule to improve ATP. Like it's a biochemical, we know. This is quantum biology, like this is like instant, like it can have an effect in the body. So now we're like, oh, there's something else going on when we put light in the body, that they see it, they just don't know exactly what that may mean. So to answer your question on, it's one of those things, like, it's something to play with the soil to do it, but to say, is the evidence there, that this is going to make a difference? Definitely the evidence is not strong enough yet. The mechanism is great. The data, we see stuff on frozen embryo transfers for uterine receptivity for those that have implantation failure. There's some research on that that's come out for people with pelvic inflammatory disease and endometriosis. There's research for that for PCOS. We're seeing it, but not good data, what we would like. But we always have to start somewhere. So we are seeing the mechanism is very, very good. And then clinically, we're starting to see that come out. And then in our clinic, yes, some people, we do it, we see their AMH change, and we see them have a terrible IVF, and then they have a great IVF. But let me put it to you this way, because again, oh, so it was a laser. Guess what? I know people that have done an IVF and it was a terrible IVF, and then they didn't do anything different, and they did another IVF and it was a great IVF. So I don't know if it was because of what we did for those 3 months before or not, because we didn't do a study. We know this.
Right, and this is the case with almost all of these experimental interventions and the natural healthy lifestyle things, is we don't have good controlled research, because to control it means you can only change one thing.
Yeah,
So which person at
and
age
that's the
44
reduction, and that's
is
the
only
reductionist
doing,
model.
yeah,
That's also a reductionist model, because health is holistic.
right. And we don't have like 1,000 people age 44 who are going to do red light therapy, photobiomodulation only, and nothing else to compare to, with or without that. So everybody who's sharing their anecdotal evidence is doing probably many things at the same time.
Yeah,
They're
and
probably doing acupuncture, and they're trying to sleep, and they're taking
absolutely.
supplements, right? So we can't even
And
tease
this comes
apart which
comes
thing
back
had the
to
effect.
comes back to the framework, Natalie, that I'm not as excited, oh, it's photobiomodulation, as I'm excited as how are we changing the soil? Because if you do yoga and meditate and do brisk walking, that will improve mitochondrial function and blood flow. So my goal is, how do I increase blood flow? My goal is, how do I improve mitochondrial function? My goal is, how do I regulate inflammation? My goal is, how do I regulate the immune system? And then I bring in things that can help do it. We get so caught up on the intervention, the how-to, versus what are we trying to do? So at the end of the day, there's many ways to improve mitochondrial function. There's many ways to regulate inflammation. And so that's when we're like, oh, let's try this. Let's do this. And
Yeah. And
if you're lazier, or you're not going to do the diet life, then you definitely want to add things like CoQ10
yeah.
and the light therapy. And if you're doing all that stuff and you're like, I just want to try everything, then you can do that as well. And I know you want to talk about PRP and stuff. We can talk about, then what about that stuff?
Let me check in with you. How are you for time?
I'm
I
good.
don't know how much time we booked in your calendar. I'm okay.
I'm good for time. Yeah.
Okay, because we're just gonna keep on going as long as we are still upright, because all of this is so interesting and valuable. But I want to put a period at the end of this paragraph with something that Anne-Marie Jensen has shared. So you mentioned her. She's been on your podcast. I've had her talking to my fertility coaching program about laser work that she's done and her results. So she's a physiotherapist in Denmark. And when I looked at her data on that she had collected, kind of case studies on the results from doing the low level laser therapy, it was also noteworthy that she was, in addition to doing that, she was doing manual therapy. She was doing massage on their abdomen to break up scar tissue. She was also doing Maji Sova, which is a physical therapy, which looks a lot like gentle yoga that I encourage my people to do. So she was doing all three of these modalities. And Giga Laser, whose product she uses, was really excited about her results and sort of like pitched it as, this is results of the laser, but actually her people were doing all these different things with her together. And in her book, Fertility and Physiotherapy, she breaks down each of these modalities and how she does it. And she has a whole chapter on the laser therapy. And I'm going to quote her in here because it's resonating with reflecting what you just shared. She says, as she's talking about the laser therapy is not as suitable for self-treatment as the Maji Sova method and the manual scar tissue treatment. However, you can easily make an effort to improve your circulation through exercise. So after this entire chapter about all the research from Japan and everything about laser therapy, at the end of that chapter, she says, "Well, you could also exercise."
Yeah.
Right?
Well,
So here we are coming back again. Here's another holistic provider working intensively on fertility with all these different technologies and saying, you can also exercise to boost your circulation. So we keep coming back to this core piece that I hope if people take away one thing from this, it's like what they say for real estate, location, 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 for
right. Yeah.
health and fertility, circulation, circulation, circulation.
And that's what chi flow is, by the way, circulation. So acupuncture is a big part of it. One of the episodes I have with Dr. Ed Neal, who's a physician and a classical Chinese medicine doctor, talks about the classics and it's how it's about circulation. That's a whole other episode that we talk about, and we go really into the conscious world. I
Mm.
want to share a piece though about Anne-Marie Jensen that you shared, that she was doing breaking up scar tissue. So while the laser was over you, the Giga laser, we have the Giga laser in Vancouver as well. She was breaking up scar tissue and teaching them exercises. But she also did a case report in 2022 where she looked at women that just did self-service Giga laser, which means they had an initial consult and then they use the laser without her. She has a room set up where it's on a passcode. They sign up online, pay online, and then they come and use it on their own. And she broke it down based on age group, and she had 60 women do this, and she wanted to see, did it help? And so those aged 30 to 34, 89% got pregnant without her being part of the treatment, just the Giga. 35 to 39, she said 87%, and that was after about 18 treatments. So they did it for 3 to 4 cycles, 6 treatments a cycle. And then 40 to 44, she said 57% got pregnant. She only had 2 women 45 and over that did it. They didn't get pregnant. But there was only 2. That was pretty small demographics. But she had 22 women from 40 to 44. And of those 22 women, she said 57% got pregnant. And that's just, so when you said, but that was just with the Giga laser. They didn't do
Okay.
anything. She didn't do her
Yeah,
manual.
those are impressive statistics. Yeah.
Too good to be true, which is why, she might just a lucky demographic, right? That she might have had, or maybe the laser is doing something phenomenal, which is why a study with that laser would be very interesting, mimicking her approach. 3 treatments a week in the follicular, so before ovulation, for 3 to 4 cycles. So these people did on average, 18 sessions up to 24 sessions. 3 cycles would be 18, 4 cycles would be 24 sessions. It'd be interesting to mimic that approach. And that Giga laser, maybe it's because it's so big, it's getting the gut microbiome, it's over that cilia plexus, it's over the ovaries, the tube, and it's got infrared lasers, 36 diodes, and it has 144 red LEDs. That's a lot of diodes that they're covering with some good power. So maybe. But at the end of the day, rather than speculate, is it good data? Is it honest data? I know Anne-Marie, I think so. That book you read, look at who wrote the foreword to that book. If you look at her book that you have there, I wrote the foreword to her book when she translated.
I didn't realize that. Or I'd forgotten. I'm sure I saw that.
She wrote it first in Dutch, I think, and then she translated and had me do a read over, and then write her forward. So yeah, so I'm very familiar with her book and Anne-Marie. So I would say she's a good person, honest person, and we should do a study, right? Because her case studies are not few. There's a lot of them, and she's reporting crazy good success rates. Too good to be true success rates, better than IVF. So it should be reported. Although I do think when she reported this, these are people that are trying naturally or doing IVF. So she doesn't differentiate of those 60 women. Okay.
I am so excited that there's all this pioneering work going on out there, right? And we're all sharing with each other to trade information.
Yeah.
It's wonderful.
Yeah.
Okay, so let's jump to PRP.
Okay. All right. So
platelet-rich plasma being injected. So someone's own blood is being spun around, and the good powerful parts are being injected into the ovaries. Is that an oversimplification?
Yeah, that's great. Well, let's say, why do they do it? Again, we see this in sports and injuries. Somebody has an injury, they'll do this. And the idea is that it'll accelerate the healing. Again, they're playing with the environment, giving the cells what it needs to support the healing. So speed up healing. Just like the photobiomodulation, it's speeding up the healing through increased mitochondrial function. So they used it a lot in injuries in sport medicine. So the idea is maybe it'll rejuvenate the ovaries. There's two podcasts I have on right now at this time of our recording. There is Dr. Wood, Samuel Wood, episode 69, and then Dr. Amy on the Egg Whisperer, episode 52 on PRP. And then in September of 2024, early 2024 of September, early September of 2024, I was at the Canadian Fertility Andrology Society, where somebody released their data on PRP in the uterus and in the ovaries. Here it is in a nutshell, and I'll tell you the difference between Wood and Amy and what we've seen in our practice for patients doing it. So Amy does PRP, and she's sharing some of her clinical cases. She's quite excited about it. Dr. Wood does not think PRP works for those of egg quality advanced maternal age. He thinks PRP works for those women in their 30s that have premature ovarian insufficiency. So, they're in their 30s, but they're acting like they're in their 40s. And then for those people that are in their late 30s, 40s egg quality, he does PRP with other growth factors. So he's not just doing PRP because he hasn't found it work in all of his data for those. Again, here we are. Once you get over that 40, I'm sorry to share this, but it's harder, but it's not impossible. It's just we need a lot more things sometimes to help out if you're not willing to go into it, or not willing or ready for a donor egg, or it's not an option. You're trying to use your own eggs. It seems things take more effort on your part and your provider's part. So
he's adding in some other
he's doing other growth factors
there. And is he sort of an experimental phase right now, or is he seeing
absolutely experimental? He has the data on his clinic. So if you look up Samuel Wood in San Diego, I think his clinic's Gen 5. But if you go to the episode, whatever number, I'm looking on my screen here to see what number, episode 69.
It's a great episode. I listened to
He'll talk about it. So in Vancouver, in Canada, that was where the conference was this year. And they shared the data that they're seeing PRP improve AMH levels, lower FSH levels in this population, even increase antral follicle counts. So they saw a lot of improvements in biomarkers.
Okay.
No change in live birth rates.
Interesting.
No change in live birth rates. Now, I didn't ask, I was in the audience, so I didn't ask this question, were these all people in their 40s? Because Wood says PRP won't work for them anyhow. Were they in their 30s? Like, were they doing, would they ever consider doing growth factors? They have seen some improvements for PRP in the uterus for implantation failure. So that they've seen some data that shows it's making a difference. The Canadian conference, and they're doing more studies on PRP. At this time, they said that they think ethically in Canada, because Americans are a different country and you guys do things differently, but in Canada, they said that PRP is experimental and you shouldn't be charging patients if you're doing PRP in the ovaries because it's experimental and the current data shows it doesn't help for the live birth rate. That doesn't mean that's a law. That's just what that's what they told the audience in Canada, that really
it's too experimental to be ethically
too experimental, and the data that they have shows it doesn't help. So they suggest that if you're going to do it, you shouldn't charge for it because the data says that it doesn't help and it's experimental. The uterus they charge for because the data shows that it's helping. And so they're doing bigger studies, and the idea is if we do more studies and we see that it does help, then clinics will pay for it. But right now, currently it seems experimental, and the data they have, it hadn't helped with the outcome. Our goal was live birth rate.
Right.
So for your audience,
can you, I'm sorry, before you go on, can you distinguish between the PRP for the ovaries versus PRP for the uterus?
Yeah.
Are they injecting the plasma-rich platelet into the uterine cavity?
Yeah.
To help with the lining to make,
Yes.
so when somebody is producing or transferring good embryos, but they're not implanting, that's when they're more concerned about the lining. Is that?
Yes. So these are frozen embryo transfers. Often they're pre-PGTA, so genetically screened euploid normal embryos that are implanting. So it's called the kitchen sink. We don't know why. So they'll like, let's do this to help with uterine receptivity. Just like there's 2 or 3 studies for implantation failure and frozen embryo transfers using photobiomodulation. One, it was kind of how I do to my clinic over the abdomen. Plus, we also do the Oshiro technique up here. But there's another one where they did intravenous irradiation into the blood that improved implantation. So, yes, it's another, again, so what do I do? It's the soil, right? You could do both.
Hmm.
You could do none. It's just how do we improve the soil? So the uterine PRP is injecting the uterine lining with the PRP, and the PRP in the ovaries literally injecting in the ovary. If you're, Dr. Amy says the type of needle you're using makes a difference. There's different styles, like in New York, where I think Dr. Amy trained, but they have their approach. One of the earlier adopters, I think it's Greece that started this PRP in the ovaries. Some say go into an IVF immediately. Some say wait 2 months to allow the impact. It's experimental, bottom line. I know in the States they charge, so they're definitely charging. And I think, I don't know any clinics in Canada that are doing it in the ovaries, except for that clinic in Quebec. They were in Quebec, but it's a study, so patients aren't paying for it. They're doing a study. And I know in Canada, the Olive Fertility in Surrey, I believe, are doing PRP in the uterus, but I'm not aware of any clinics that are doing PRP in the ovaries at the time of this recording in
Hmm.
as a
Thank you.
treatment outside of a study. In the States, I think it's become quite popular or becoming quite popular. So when I talk to patients, my patients that have used it so far are the really, really difficult ones, the ones that have been suggested to do donor eggs, but they don't want to do donor eggs at this point in time. So they want to leave no stone unturned, understandably, and do whatever they can. We've seen some interesting changes in biomarkers. I've seen 2 of them where they have had poor IVF cycles, counsel cycles, go on to have babies. So I've seen that. And then I've seen also, we've only had a handful where we saw changes in some of the biomarkers, but no change in IVF outcomes, like no change in euploid embryos at this point in time. And then we had one that just did it where they, it actually is coincidental, I don't know, but she's kind of gone into menopause. Like her FSH is through the roof. She's not ovulating. She was having some regular cycles before, but she's had that reaction. We're just starting to look into it. So I don't know. Is
Right. So we're back at it's not a magic
not a
pill.
magic bullet.
It's very experimental. We're kind of in the Wild West. It's exciting to have these possibilities,
Yeah.
but we don't have
And I
strong
think
data.
it's say I don't you'll have to look into it because I don't know. It's not my expertise, PRP. I see patients going through it and I interview people.
Mhm.
I think it's safe because that's the question. So it may cost money, but I think I don't think we're causing harm usually. I do have this one patient that's it's a weird, her situation is very weird for after her PRP. And then like going back to the laser, we know it seems safe and non-invasive. It's
Mm.
do no harm, right? Is what
Right.
we feel pretty comfortable about. But
Yeah.
the PRP is something that people are still checking out, and with time and as they get better, based on this demographic or like what Dr. Wood's doing, maybe that'll make a difference. I don't know at this point in time, but like everything, we're trying to figure out can we do the 4-minute mile, and as many people know, they try and they didn't succeed, and then one day it was successful. So right
Mhm.
now we're still trying to do that 4-minute mile and know what to do so we can replicate it for many. But some people have had success with it. It was that last little thing that did something to their soil and it worked for them. We just don't know why for them and not others.
Right. Okay. This is really helpful. Let's jump to the topic of mini and natural IVF. So this is Standard IVF uses a certain amount of stimulation to trigger the ovaries to release a bunch of eggs. And there's also the belief that for particularly women in their 40s, you can overstimulate and shut down the release of the eggs, and you may get a better result from giving no stimulation and just capturing the egg that was coming anyway, or low stimulation, just a little boost to get 1 or 2 eggs. And so I know that you've had Dr. Lyndon Chang, who's
Yeah.
kind of specialized in this, on your podcast. What is your sense of the appropriateness and the benefits of the lower stimulation for those who are going the IVF route?
Right. So that Lyndon Chang episode is episode 76, and that Samuel Wood on PRP, episode 69. He also talks about mini stims or low IVF in that sense, drug approach. So I'm not an IVF doctor. Let's just remind the listeners, right? This is not my expertise. So I will give you some frame to help you make your decision. I can give you information, but you'll have to make this decision. So I've spoken to, also outside my podcast, many doctors about this. And if I put 10 of them in the room, 5 will say you should do mini stim, and 5 will say nonsense, right? You got to give them a high dose of drugs. So my thinking would be, if this was I'm trying to start a family, this is my wife going through this, and we did a couple of traditional, we're in our 40s, and we did a traditional IVF, and we didn't get the response we liked. Then I would think of Einstein's quote, don't keep doing the same thing over and over again, expecting different results. I may want to do that mini IVF idea, low stim, try something different just to see if your body responds. The theory, some people, they just don't agree with it. They say the data is not there, but what one side is saying why you do low stim is that hitting the ovaries with a lot of drugs, you can take a good egg and make it not good. So maybe that environment, right? But there are doctors who say that's nonsense. That's not what's happening. But just so you know, that's what some groups are saying. Our goal is a good egg, right? We want a good egg. And so we want to do the things that can support that. So one of the things I always say, coming back to the lifestyle, if you're going to go through an IVF and you're in your 40s, and we're learning that some say that the drug protocols, if they're heavy drug protocols, could possibly impact your egg quality, because we lose resilience. We already know as the ovaries age, they lose their oxidative protection as well. So we get a lot of oxidative damage. So build up the resilience as much as you can. So on that tangent, antioxidant diet, antioxidant supplement, stress reduction, and then just in general, give your body, your cells a chance to be resilient. So if you're going to go into IVF, the acupuncture, the meditation, the movement in nature, the eating well, give your body support so it can handle the medications to try and grow several eggs. When the goal is to get a baby, right? And so I think, I don't know. So I'm being clear here. This is an opinion. Everybody has an opinion nowadays. So I just won't post this on a social media page, right? You've asked me, so I'm going to give you my opinion, but otherwise it's just an opinion. It has no, I don't have a lot of backing for this. You're not going to go after quantity at this stage. So I think that would be a strategy that's worth looking into, is we just want to get we want to take home baby. So we just need a good embryo from a good egg. And so in this case, that may be the strategy. Rather than trying to get 6, can we get 1 or 2 that can turn into an embryo? If the theory is we could damage them, which I don't know if it's the case. And I'll repeat what I said at the beginning, because everybody's like, oh no, I shouldn't. Then my clinic wants to do high dose. I don't want to do it. Are they going to damage my eggs? That I don't know, but I think there is no right way at this point in time. So whatever, if you do a cycle and you have the ability to do another cycle, because the first cycle you didn't respond well, then maybe change up the protocol and do it differently. So if you did a mini stim and it was a very poor response, then maybe go the old-fashioned IVF rule, or vice versa. You did it the other way, and see if it gives you a difference.
I I think it's worthwhile to share your intuitive impressions, even though you're not an IVF expert. You talk to so many people, you see people going through this, and you have this energetic sense of what might be happening for a patient. And my impression, also as not an IVF expert, but watching many people in my fertility coaching program going through these things, um, I see a variety, and I encourage everyone to trust their intuition, learn as much as they can, and pick a direction, go with it, see what happens, learn from it. Right. So I see people starting with the higher stimulation. I see people sticking with the lower stimulation and all kinds of mixtures. We did have somebody in our program who I believe was 44 years old and went through multiple rounds of low stimulation to just get one or two eggs at a time and had a successful outcome from that. Um, but the things that like intuitively feel compelling to me about this is that it's not a numbers. I don't believe that it's a numbers game. The more eggs you get, the better chance you have. I think that you might be pushing the body to push out eggs that weren't necessarily the best one, and that you're interfering with the natural selection process. Like that may be what's happening. And if you can get, it's just a less is more kind of approach. You
Yeah.
can get what's already coming, maybe with a little boost, and then you're also not disrupting what the body does naturally on its own.
Yeah.
So I've seen
And
people
it's
do.
individual too, Natalie. It's in
Mhm,
because it's that's
yeah,
where you talked about the beginning. There is no general person. When we say there's things you can do, it's an individual thing, and less is more in many cases, and
mhm.
sometimes more is more too.
Right, right,
So
and there are some people who have a constitution that they know that anytime they've had any kind of hormonal intervention, it throws them way out of whack. I said, "Well, that's probably a person who's a candidate for lower," right? Like, what is your experience with your body?
you just gave me if I may share intuition, because we now know, like again, through the beauty of science and Western medicine, there's some genetic lifestyle testing that we can do. And so some of these people, we looked at, they have poor detox pathways, or they how they convert their estrogens isn't great. And so these may be people that don't do well on the birth control pill. They have terrible symptoms, or we're seeing in the clinics here locally that some women do not respond well to the medications in a frozen embryo transfer, and they're getting better results for natural, right? I suspect, because we've done this for some of our patients, some of the patients we see that have really negative side effects to the medications, whether it's birth control pill, IVF stim, or the drug estrogens in the FET, that some of them have those poor pathways.
Mm,
So there's somebody where I'd be like, they probably would do well in a natural cycle or a low stim. And again, this is where integration we're starting to learn. So yes, that's why for some people, less is more. And for
mhm,
some people that don't have those genetic predispositions, I'm hypothesizing more is more,
mhm.
because their body can they have the genes to process the medications.
That makes sense to me too, right? It's, and I think the more that we can get to that kind of a customization
Yeah.
and appreciating the nuances of each of these things, the better everyone is going to be.
Yeah.
So the lower stimulation, I think, is kind of seems like it's kind of compelling, worth for people to consider. And it's not a different cost, although I mean it could be because some people
It's
will
lower
do.
cost because
Yeah,
lower
some people
meds.
will, right, less drugs. Some people will do egg banking. This also sounds kind of appealing to me. They
Mhm.
do, uh, a stimulation round or low stimulation or no, and then maybe they take a month off, and then they do another one, and then they kinda give the body a chance to recover, and then prepare for a transfer with.
Yeah, well, just in general, the data the last data I looked at, the frozen embryo transfers have higher success rate than fresh transfers. And that makes
Interesting.
sense because when you do an IVF, you've overstimulated the ovaries, and so there's higher hormones than normal in a normal cycle, and you've caused a little trauma in the ovaries to retrieve the eggs. So who knows inflammation, what's going on? So going into a calm environment, like a
Mm,
frozen, it makes sense that that would do well. They changed from, I've been doing this since 2002 with fertility, practicing since 2000. So at some point in my early practice, they got into the vitrification freezing. So they always did fresh because fresh had a higher success rate because they lost embryos in the freezing. But
Wow.
vitrification is so good that they like to freeze because the freeze and thaw is not an issue, and they find they get higher success rates with the frozen embryo transfers. And again, at the time of this recording, that's the data I had saw. More data may come out, you may see something different. So that's the beauty of science. But at this time, if egg banking makes sense, and then waiting a cycle before you do a frozen seems to be give you a little bit of an extra chance of implantation.
Okay, so that is interesting to hear. We're kind of having some similar perspectives on that angle, just watching people going through this. The next category may or may not be something that you've delved into much, stem cell therapy. So using someone's stem cells sounds almost similar to PRP, but you're using someone's own body stuff to stimulate better growth and rejuvenation.
Well, I mean, that's the holy grail, right? It's stem cells, what we hear. I will share a few things on this issue. One is I know almost nothing about it. so I'm not going to give too much of an opinion on it. I will share what's really cool is the photobiomodulation on the bone, the sternum, because we need to get to the bone, or the tibia, has shown to increase stem cell proliferation. So that's pretty cool from a theoretical perspective. If only we could tell those stem cells to go to the ovaries or wherever you have an injury, that would be cool. But maybe there's some wisdom in the body. But just to let you know, another reason for photobiomodulation that excites me. This, going back to our framework, it's like the soil. So this is where you're probably doing something very well to the roots. So rather than just giving the environment for the roots to do something, this may be where the roots may have issues. So even if your soil is good, the roots don't have the capacity to take anything from that environment to make the plant thrive. It sounds like stem cell therapy is like rejuvenating the actual root, so then it can do well at taking things out of the environment. I think that would be the theory behind it. I don't know what that looks like now. I think I only know because a patient asked me just this week about stem cell therapy for an IVF, and she said, based on her research, that they're doing it in Israel. And that was just like yesterday or 2 days ago, and I have not talked to my colleagues in Israel to ask them what are they doing, what are they seeing. So I don't have a comment because I have no knowledge on it, and I have zero experience of anybody going through it. But I gave you the best I can share with you, I guess, on that. So let's go to the next question.
I actually need to look back at my notes because I have a member of my program who's in Israel and had success with IVF. And I think she may have been experimenting with those things. I've got to go back and check my notes now that you mentioned Israel.
Yeah.
But I think, if the stuff that we're like just starting to hear little murmurs about, we can assume that it's very experimental. There isn't data yet. And if somebody wants to explore it, they're going to be one of the first guinea pigs. And
I think the United States, I don't know which president, maybe it was Bush, but somebody really put restrictions on stem cell research. I think where they don't have as many restrictions or ethical considerations, like China has been doing a lot. So there's probably stuff coming out of China with stem cells. And I don't know what Israel's doing in their country, but I'm going to ask. I don't know people that I can ask. Actually, I do know people I can ask in China. So I'm going to ask what kind of data is out there. I'll find out.
Maybe that'll be a future podcast episode.
Future podcast. Yeah.
The next one, maybe kind of similar level of novelty, is epigenetic therapies. So
I'm not even familiar with it. I mean, I know epigenetics. Epigenetic therapy is what you're doing and I'm doing. Epigenetics is turning on and off genes. So just for an example, when you are under stress and alarming, you release all, the stress hormones, cortisol, and all the adrenal hormones. You're turning on and off genes for disease and infertility, for example. And when you are feeling safe and you got the parasympathetic, you're in alpha brain waves, and you're releasing serotonin and dopamine, oxytocin, you're now turning on and off genes. So the environment turns on and off genes. So your thoughts turn on and off genes, the food you eat turn on and off genes, the IVF drugs. So you're always turning on and off genes. So epigenetics is, it's not the exact definition. If you Google, you'll see the exact, but it's the idea of how you can turn on and off genes for longevity, health, and reproduction.
And I think this particular piece that I was reading was having to do with delving into what is someone's unique genetic makeup and how does that influence their reproductive issues, and how can you customize things based on their genetic.
Well, that's the genetic lifestyle testing where you can get insights into how people respond to hormones, how they respond to exercise. I've done it, for example. So I'm a poor methylator. I make it. I'm poor at resolving inflammation. So when I did this, the first thing we looked at is like, holy crap, inflammation, male heart. Like, what's going to happen to my heart? But in my looking at this genetic profile, I have Teflon arteries. So I was like, oh, great, nothing's going to stick to my arteries. So then the consultant goes, yeah, but where's it going to go? Like, you better be worried about your brain then. Like, where's this inflammation going to go? Alzheimer's, Parkinson's.
Oh,
And
wow.
so, but then you start to do things to affect it, right? So there's certain diets for anti-inflammatory, certain ways of exercise. I also these are not genes like you have this disease. These are, you're predisposed. So you're predisposed based on diet and lifestyle, right?
Mhm.
And so by changing your diet, by taking certain supplements, the theory is you can help turn on and off genes so you don't develop the disease. So
Yeah.
because I have the poor methylation, I'm an inflammation maker, I check my CRP and homocysteine once a year to see if I'm inflamed. And
Oh,
so I'm good. I check. I'm also predisposed to low vitamin D. So if I don't keep my vitamin D high, my dosage, and I take a break, it drops drastically. I played with it. If I take it regularly, it can stay nice and good at a good level. But if I don't take it, I drop. I'm predisposed. I
okay.
also salt-induced hypertension. So I'm somebody that probably shouldn't put salt on my food.
So okay. All these new directions. So I wasn't aware there's a test
Yeah.
to find what is that what is it called?
There's all kinds of these lifestyle DNA testing. We do them at AccuBalance. The one I like because the naturopathic doctors I know have played with the report, because there's so many of these things like 23andMe is doing that kind of testing, but they don't give you a report to make it so you know how to eat and live, right? And so it's not just the testing, but how good are they using the report based on the data? Because the more people that do this, the more data, the better they can create reports to say, this is what we're learning from our population. The one I like are my good friends in Toronto are behind the Fern DNA test, Fern,
Okay.
Fern. And I like it because the company that they use to do their testing, we use. So I like that company. They're really good. And there's a lot of good companies out there, by the way. But I like what these naturopaths have done because they made it very fertility tailored. Um,
Hmm.
and so again, it helps us with, when I see somebody that's, example, remember that thing called COVID and everybody was getting vaccinated.
Yeah.
For me, I was like, crap, I'm going to get vaccinated. But I was like, I'm the poor methylator and I got poor detox pathways. I could be one of those people that has the bad side effects of vaccines. We hear some people have bad side effects, some people don't. Well,
Yeah.
this is that individualized. I was like, based on my genetic profile, is this something I want to do? Because I got into health. I'm an accountant. I got into Chinese medicine because I was a sick boy. And I finally had a shift through seeing a Chinese medicine doctor when I was an accountant that changed my life, that I went back to school and study. So I wasn't given the good genes. I didn't get the good deck of cards. So I have to work a little bit harder than the average person to stay healthy. Just like somebody who's 40 has to work a little bit harder and be more diligent than somebody who's 20.
Right.
Okay. Um, so the genetic testing, and you really want to, like our naturopaths, we get the report and then they go through it and then they put their lens on it. And then we even make it more specific for the patient. So at our clinic, and it just lets us know what other tests we want to run. Cause when we see all these things like your poor methylator, then it lets us know we want to test other things now. And then things that, like for me, nobody would be testing homocysteine or CRP like me. But I test it every year because I'm predisposed. It doesn't mean I'm going to get it. or have an issue, but I'm predisposed. I'm predisposed to low vitamin D. So I check it at least once a year, sometimes twice a year. And that goes into our mini stim. So somebody who can't do a frozen transfer with the medicine, or somebody that doesn't respond well to birth control pill, like they have these reactions, or somebody who's my perimenopause patients that want to do HRT, you know, some of them, there's that risk for a heart attack or stroke. I think it was stroke. You know, we can kind of look at their genetic profiles. We can't say, oh, you will or you won't, but we can see the risk factors of, oh, you may be one of those people that stroked out in HRT because we see your gene profile. And then to circle back, epigenetics, what can we do to turn on and off genes? Because you're predisposed, meaning this gene can get turned on and it's not good for you. So what can you do to keep it from being turned on?
Right. For me, that's going to be the type 2 diabetes. I
Yeah.
need to watch out for that. And I feel like I have those kinds of tendencies. So I need to watch the lifestyle so that I don't develop that condition.
And that's in that test. It tells you whether you're at risk of being addicted to alcohol too.
I think I got some of that when I did the ancestry DNA. It told me a
Yeah.
few
Well, they're
things.
all testing the same SNPs. Well, not all same, but they're
Yeah.
all doing the big SNP test. The key is how much data they have in their pool, because
Mm,
you know, small pool, less accurate versus you know, and then the report. So the early days when we did this, you needed to go to Harvard to interpret the friggin' report. Like they send us, we're like, you know, it was just ridiculous. But they've gotten so much better at creating a report that's user friendly for the public and the practitioners.
very interesting. Good to know. So let's jump to supplements. Now, this is obviously an area where people are often looking for that magic pill.
Mhm.
And there are so many supplements that people consider. The most compelling research that I see is for CoQ10, ubiquinol, and then there's a whole bunch of other things out there. Instead of going down the rabbit hole of all the supplements, can you give us like the quickie overview of, obviously you're going to customize it per person, but your
Yeah.
general feeling about how much emphasis should be on supplements, and are there super supplements that you think are really worth everybody considering?
Yeah. So again, supplements the soil, right? So they're like fertilizer, right? So again, I think yes, I like supplements. I'm using supplements, and I'll share my kind of the general idea that I usually have people on. They've listened to me enough that they show up the first initial consult on the supplements that I mentioned, which I think is great. They've already started their pre-conception care. Supplements are supplements. They're not to replace diet. So your first thing is you're eating well and you're moving your body, you're sleeping, and you have a stress reduction program. So that is key. And then you supplement that with supplements. They're not drugs. They're supplements. I just got to keep saying supplements because people like to treat them like drugs. And so they're not. They're supplementing a good lifestyle and diet. And so somebody that has reproductive challenges, a prenatal, we just know this because you want to get all the nutrients you need. Plus, you want to make sure you have adequate amount of folic acid. And we like a prenatal that has methylated folate versus the synthetic folic acid. Some people, certain ethnicities don't. There, you can see that in the genetic testing, by the way, but they don't metabolize or process these properly. Um, I like an essential fatty acid just because it's essential. Your body needs it, and it helps with hormonal health. It can help regulate inflammation. It can help with mood. I like CoQ10. Some people like ubiquinol versus ubiquinone. I still use ubiquinone. I use ubiquinone CoQ10 with PQQ. It's a combo that comes together. And I just like it because that's what the research has been done on so far in mice and humans is on ubiquinone, not on ubiquinol. So, and the version we use is the version that the clinic in Toronto uses that did the study on mice and CoQ10. So I called the clinic and said, "What are you guys doing?" And they told me, and I figured, well, if the guy that did the research is using this supplement, then I'll use this supplement. So and some people use biquinol. I think probably both. There's There's an argument for both, and you can think of the pathways in the science. So if people come into my clinic and they're on a biquinol, I don't take them off it and put them on mine. I'm like, fine, at this stage. But I just have my preference because I'm following somebody else's lead. So we said prenatal. I like N-acetylcysteine, NAC, because it's a precursor to glutathione, which is the mother antioxidant in the body. We do glutathione pushes and IVs in our clinic. We're not sure how well the glutathione orally is absorbed. We found a brand or two that liposomal types that they claim are absorbed, but most of them won't get absorbed well through the gut. So I still think an IV push or an IV is the best way to get glutathione versus orally. We tried pushes into the intramuscular into the muscle, and we didn't think we're getting the same result. So we do pushes or IVs with glutathione. I say that because NACs are precursor to glutathione. There is some research using it for PCOS that shows benefit, and endometriosis that shows benefit. Talk to your practitioner for dosage. Dosage does matter. You can underdose it. And it's kind of helps the liver do its detox, which I think is important. And it's been used in some research in an IVF setting as well to help with IVF for reduced miscarriage. So I kind of like NAC. It reminds me of the Big Fat Greek Wedding I watched years ago. And in the big fat Greek wedding, the grandpa Windexed everything. You have eczema, you have he Windex everything. So everything got Windex. NAC is kind of like, I love it because it does such wonderful things for the liver. It's anti-inflammatory, good antioxidant, that I think it's just really good for the soil in most cases. So that's why I like it, even if you don't have PCOS or endometriosis. We'll use myo-inositol in some cases because it's shown to help with egg quality and regulate blood sugar. And sometimes probiotics we'll use for people, but in general, a prenatal, a fish oil, NAC, myo-inositol, and I like magnesium bisglycinate over citrate. Unless you suffer from constipation, then I'll use citrate. Because it will affect the gut and you'll have diarrhea with the citrate if you take a high dose of it. So people with constipation like it. But otherwise, I like bisglycinate because it won't give you that diarrhea. And the magnesium, your cells need it. It's just a really important mineral. It's important for the adrenals, helps you, it's important for sleep, the nervous system. So that's key. And then vitamin D. Vitamin D, if it's low, because it affects inflammatory pathways, you can have an irregular cycle from it. There is a correlation between low vitamin D and low AMH. So if it's helping with inflammation, if it helps regulate the cycle, AMH, it just seems like we're kind of deficient in it. So vitamin D is something I put pretty much everybody on as well. We test though in our clinic, and we have a range. The range is quite generous. In Canada, they changed it. I know we have American users here. I know the Canadian units because we use metric over here, and you guys do not. But it used to be 75 to 150 picomoles per liter, and now it's 75 to 250. So they actually expanded because they used to say, oh, if you're here, it's too high. Oh. They've changed it. In our clinic, our naturopathic physicians, our functional medicine style practitioners, they kind of like it at that 125 mark. So if you're at 76 and you're in range, that's not a functional optimal range. Although you're in range, we're looking for vitality. We're not looking for you can just get out of bed and you're exhausted and you're struggling with fertility and you have mood issues. We're like vitality. And so vitamin D affects bone health. Vitamin D affects your immune system. So you can have fatigue, you can have aches and pains in your body, you can get sick all the time. You can have there's a correlation between infertility and miscarriages in some of the research. Some say now it doesn't, some say yeah, but so just take vitamin D, get some sunshine. So those are my kind of core supplements. And then if you have PCOS, or if you have endometriosis, or if you've had repeated IVF failure, then we may modify dosage or some of the supplements we're doing. And then I use Chinese herbal medicine a lot in my practice. In China, herbal medicine is more known for reproductive treatments than acupuncture. In the West, acupuncture is more popular. It's internal medicine herbal. And just an interesting couple of studies. There are studies in Korea and in China where they're using herbs in an IVF setting, because some clinics say no herbs during IVF, but they show higher pregnancy rates when they're doing a couple of herbal formulas so standardized that they've used to increase IVF success. And also in a mouse study, we talked about ATP earlier, the mitochondria. Some of the herbs that are called yang tonics and chi tonics, there's all these categories for herbs: clear heat, move blood, drain dampness, tonify yin, yang. There's a certain category that in mice, it increased ATP as well. So
Okay, so when we're talking about supplements, there are so many possibilities out there, and you listed off a number of, I think, pretty well-known ones that have more research support behind them.
yeah,
And
and there's a cost benefit, so you can keep taking and taking, but then you can't eat because you're taking so many pills and there's so many capsules. So I think you can lose the benefit. Some are great, like leading up to an IVF, like resveratrol is really popular, but you shouldn't be taking that in a frozen or around implantation, right? So that's why you want to talk to some experts, because people sometimes come in with supplements that are great while you're trying, but not great when you're close to implantation, for example.
yeah, and see, this is where I feel the pain of the people who are on this path and trying to figure out what to do. And here's, a dozen supplements that could be good, but it depends on how you take it and when. And there's a cost to them. And it's not 100% clear what's going to be beneficial, but you don't want to miss out, right? It
Yeah,
becomes a little challenging.
well, it's challenging, but there, you talk to a coach like yourself, or talk to, my clinic. That's what people come in. They come in with a bag, like, I mean, a
Yeah.
suitcase.
Well, and I refer people out, say, work with a
Yeah,
naturopath, talk
yeah.
to somebody who does this all the time. Don't ask me what brand of Umiquinol or Coke you tend to use. This is not my specialty area.
And we change it. Like I guilty of it too. Like sometimes patients come in and goes, okay, I want to go over my supplements, and they bring it in. I'm like, holy crap, I prescribed all that. All right. We're not, so because they're the ones opening up the cabinet and stuff. And I forget to, in this case, I added something, but I didn't take away something. So sometimes they'll come in and I go, I prescribed all those. Usually it's somebody else. And I'm like, okay, we're cutting this down. What do we need for your soil? What is really we need? And then everything else is redundant. Right. And
That's
so,
interesting. Like,
but I've done it
you
too, where they
become
come in and I'm like, oh my God, okay, thank you for bringing in your suitcase. We're changing this. This is ridiculous. You can't take this many supplements.
I really appreciate hearing that and your authenticity about that you may be suggesting this at this time and this and add in this and that and this. And it may even get away from you
Yeah.
where you look at the big picture and you're like, wait a minute, the
Yeah.
whole system is overcrowded now. We need
Yeah.
to
No. How do
dim
you
this
eat?
down.
Like I look at how do you eat? Right. Like,
Yeah.
and
And I
sometimes,
think,
like PCOS, there's, sometimes I'm like, for 3 months, we're going to be taking a lot of pills. Right.
mhm,
But then we can pull back. Right. So
yeah,
that's the issue. What happens is, and I'm guilty, and most of my colleagues are, it's not meant to be indefinite, this much at this dosage. After a while, and especially as we see symptoms or signs change, we can lower dosage or pull back.
yeah.
And and
And
and
that's the
yeah,
principle that I recommend to people is know what you're taking and why, and then pay attention to how it's impacting you so that you know how to go forward with it.
you have to
Um,
advocate for yourself when you talk to the Western docs, but when you talk to us too. So when patients come, like I'm not in your head and I'm not living in your house. So, you know, I'm here to give you my experience and my knowledge, but I'm not here to run the show. I'm here to give you agency so you feel back in control and you pick my brain, and I make my recommendations, of course, and help you make your decisions, but it's teamwork, right? And
yeah,
so come in and tell me, so when somebody comes in, they didn't come in all angry. They just said, okay, what do I do? And I had
I always go through
just the
this.
other day, a virtual, somebody from the States, they said, I feel overwhelmed. There's so many choices
Yeah.
and there's so many things I'm taking. She's in her 40s banking eggs. She's single. So she's banking eggs right now, not even embryos. She knows the whole story about age and egg freezing, but this is what she's doing at this point in time. Um, not ready to make embryos with a donor sperm. And she just wanted me to help her get through the overwhelm of all the things that are out there and what she can be
Mhm.
doing. Right. And so we come up with a plan and we find out, where somebody's coming from. I have people that fly to my clinic to get treated by like the Giga Laser and see us. And, they'll stay a week and get treated. And I've had some people at 52 say, I'm coming in. And I'm like, don't come in. It's not going to flip the switch for you. You're
Mm,
52. Don't,
mhm,
do not come in, you know? So we can, I went on a tangent, but the point is, um, we're knowledgeable, and we're, in quotations, experts in this area, but you're also an expert of your own body. You talk about this intuition, and
mhm,
so we're here to guide and facilitate and make recommendations, because I went and did training and I have experience that you don't have, but I'm not you, and I don't live in your body, in your house. So that's where it becomes individualized and it becomes a conversation, and you do need to advocate for yourself, and this ties into your work. If you fight with reality and you're thinking, I shouldn't have to advocate for myself, well, now you're causing undue stress, because the reality is you do.
mhm.
You do. And when you go to the doctor, you need to play the system and ask questions to help them dig into their brain to come up with ideas for you. You don't just sit there and say, now heal me and tell me what to do. You got to ask the right questions. And what do you think? What do you think of this? And people say it shouldn't be that way. Well, maybe, but it is that way.
Sorry, this is reality. And
Don't
it's so
go with
funny because
reality.
when we spoke about a month and a half ago, you had invited me to your podcast and want to hear more about what I was doing. And I realized in reflections, like I was struggling to summarize what I do in my programs because, yeah, there's a mind body piece. I have these meditations, but I don't stop there because I see need for all these different things, like teaching people how to advocate,
Yeah,
teaching people that they need to advocate, teaching people how to have a voice, and realizing that you don't just lay down and say, make it happen.
yeah,
You need to be a participant. There's so many pieces that fit together. It's not just one area, the acupuncture or the meditations, or, it's all these things fit together. So what we've gone through is we've touched on a lot of these more novel interventions, the light therapy, PRP, low stimulation for your ovaries, stem cell therapies, and things like that, and the supplements. Let's do a quick rundown now of the ordinary stuff, the stuff that
okay.
everybody has heard about. So, when we look back at all that other stuff, we feel excited about certain technologies. Research is spotty on some of it. Some of it, you're just going to be a guinea pig. Good luck. Try it out. We'll keep our fingers crossed for you. But what about these things that have been around for eons, like sleep? How
Yes.
important would you say sleep is in this picture?
It's essential. In Chinese medicine, it's yin time. It's your time to restore. If you don't sleep, you don't heal well. We know this in the West. You want to make somebody insane, just keep them up for several hours. If you're lacking sleep, increases cortisol levels, which plays with your blood sugar levels, and then eventually you're tapping on the adrenals. And now people have a midsection gut. I can't lose weight. If you're trying to lose weight, you're going to want to sleep. So yes, sleep affects your hormones. Sleep affects your blood sugar level. Your brain does a little cleansing at night, so it's essential. And you'll go insane if you don't have good sleep. So, and we know there's a rhythm. So going to bed, if you go to bed at 9:30 p.m. and sleep for 8 hours, versus go to bed at 1:30 a.m. and sleep for 8 hours, same amount of sleep, your body will do better usually on the 9:30. You'll feel more refreshed and more things happen, because there is a rhythm that's happening in the body in general, because there are some people that have a different rhythm, and so that may not be them, but the majority do well if they
So
go to
I
bed
think it
early.
would be fair to say getting good quality sleep for your type is
Yeah,
important.
good quality sleep for your type, but sleep is key. I always ask people, can you fall asleep easily? And if you fall asleep, if you wake up, can you fall back to sleep easily? And if you wake up, or when you wake up, are you well rested? So that's one of the things that we address in my practice for all health issues, but fertility is, if you're not sleeping well, we use acupuncture herbs and the supplements to help you sleep and
So
mind body sleep.
a couple things I want to add in there, because I know some of my listeners are struggling with insomnia.
Mhm.
And when we talk about how important sleep is, we're like throwing gasoline on the fire of their insomnia. So just as the therapist in me wants to send that message that if you're struggling with sleep, there are many ways to approach that. And it's really a red flag waving saying, hey, there's something to work on here. But I want to really protect people from going into the freak out zone. Every time they're lying awake looking at the ceiling, they're going, I'm killing my fertility. Oh my gosh.
Right.
And of course, that interrupts their ability to
Right, they
sleep.
get stressed. So,
Right.
the conscious work, because again, we similar background here. My background is hypnotherapist, and just the conscious work I do in my practice, like your app and your meditation. So I'm a great sleeper, but there are times where I wake up at 2, 3 in the morning and I'm awake. What I don't do is stress about it. So I've trained my mind. I just say, I'm awake now. I do not turn on the TV. I do not look at my phone because that will affect your circadian rhythm, the light. So you definitely still want to keep it dark. Do not get up and walk around and do stuff is my recommendation in general. So what I do personally is I have a breath technique. So I'll use my in for 4, hold for 4, out for 8 to calm my nervous system. I have a few other techniques that I share with patients that they can use to kind of self-hypnotize themselves into a state of relaxation. If that's not going to work and I'm awake, my phone usually is always geared up for a meditation anyhow, because I like to wake up and do those. But I will put on, let's say, one of your meditations, Natalie. If I'm awake, I might as well feed my brain good stuff. So then I put on meditations. I'm awake and I'm in and out of sleep for 4 hours. And I don't know why, but when you wake up at that crazy hour and you can't sleep, why is it that an hour before it's wake up time, all of a
You
sudden you
finally get
feel
your
that
deep sleep.
beautiful sleep? You know it, eh? You know what I'm
Yeah.
talking about? That beautiful sleep is coming over you. And I'm just like, oh man. And my attitude is I will probably be tired today and I will find time to catch up. I will find another day for me because I don't have sleep issues, but I do have times where I don't sleep well. And so having strategies in that it's dark in the room, don't go on your phone. So rather than going on your phone or TV, what can I do since I'm awake now? And so feed your brain with good stuff, feed your subconscious. So grab one of Natalie's meditations and just start nurturing your body because you're not sleeping. And if you have a real issue with it, this is where I use my herbal medicine. I use my acupuncture, that magnesium, and my mind body tools to see if we can heal the physical imbalance and the mental body imbalance to allow you to find that sleep.
Yeah. And I think when I looked into the research, there was a lot of research about better, sleep supporting better fertility, better hormone balance, everything. So let's look at exercise now. How important is exercise?
Exercise is important. I'm going to pull out a book. And exercise is movement. So brisk walking, right? It doesn't have to be intense exercise. There's a book by Dr. Kara Fitzgerald, Younger You. And she looked at changing a few key factors. And it was over, I think, only 4 weeks, 8 weeks. And there was like a 3+ year change in biological age, which is what we want in fertility, right? Be biological young. And one of them was in no supplements. It was just diet, stress reduction, community, and microbiome and movement. Movement was one of the keys. So you need to move. And so movement is brisk walking out in nature, ideally, if you can, but just walk briskly. That's it. You don't have to have an intense workout. You don't have to overdo it. That could even be an issue, actually, those high intensities. Possibly. There is research on that it could be an issue for some people. So just movement, just get up and move and get your heart rate up a bit where you're doing brisk walking, not a la-di-da hike, but really move and do a half an hour walk every day.
And what about the nutrient? I mean, this is a setup. How about the food that you put into your body? How important is that?
It's important because it's the fuel for your body. So it's very important. And
nourish the soil, nourish the plant.
yeah,
It's
and
just,
we wrote a fertility book that's free on our website. So if I may, on acubalance.ca, and that's 1C, acubalance.ca, because we're Canada, CA, a pop-up comes where you can get a free copy of the book, which has 21 days of recipes. So what we did is we looked at the nurses, Harvard study where they looked at several thousand nurses over, I think it was 8 years, that improved ovulation and fertility. And then we took the Chinese medicine, functional medicine, and we created a diet. Now, the first book I wrote with a nutritionist that helped me, so I had a writer help me with this. The theory was great. It was a thick book, free too, online. Great book. The recipes tasted terrible. So Dr. Kaylee McIsaac at my clinic said, off camera, she said, Lauren, your recipes taste like shit. Like, you don't cook, do you? And I go, I don't cook a lot. No, she cooks. So what we decided is to take the book and we updated and we simplified it. We got rid of all the crazy research and science, which is important, but we really brought down to the essentials. So it's an easy read of what you want to do and why when it comes to fertility diet. And then we gave them 21 days of recipes that Kaylee found or put together. And we get email feedback of how good these recipes are. So if you're looking to what to eat, check out the fertility diet that we have on AccuBalance. And I'll share this when I talk. We looked at different diets. And if you look, there's a whole bunch of different diets and they conflict. Mm-hmm. Eat carbs, don't eat carbs. Eat meat, don't eat meat, right? What's going on here? Well, here's what they all have in common, which is probably why they all work, is they say no processed food, no refined flour, right? That's the key, is they're getting rid of the chemicals and the crap that we put into our diet. So if you eat a whole foods diet, then you can have meat or not meat. Obviously, you probably want your meat to be grass-fed, non-hormonally treated, because that can impact the meat quality. We already know that if animals is not grass-fed, their omega-3 to 6 ratio is different, and they don't have the same capacity for CoQ10 in the meat, for example. So you want grass-fed versus beef versus grain-fed beef. We want more free-range movement. Now, it would be cruel not to give an animal an antibiotic if it cuts itself and has an infection, but some of them, because their diets are so poor, they're constantly needing antibiotics and hormone treatments. So we don't want those that are regularly given antibiotics for just because they're such poor health conditions and hormonally treated. So you want a free range or grass-fed beef and animals if you're going to eat meat. And then just avoid the processed food, refined flours. So what does that lead you with? It leads you with fruits and vegetables, right? Drink water, maybe some herbal teas, stay away from the sugar drinks and the sodas. And that's why I think they work for so many health conditions. It's more that we're putting in poisons in our body and food that's empty, so it's full of calories but not nutritious, that's causing the body to struggle and suffer. So if we just pull away the things that are suffering, all of a sudden the people thrive. And then we know complex carbs better than simple carbs, right? And so, and again, we go through this in the diet. So that's why, can you carb or not carb? You don't have to carb, but if you carb, here's kind of the better carbs. You don't have to meat, but if you're going to meat, here's the better meat, you know? And that's kind of what the diet book goes through, is just a general, here's kind of what you want to do. And it basically turns out that it's an anti-inflammatory, low glycemic index diet. And that means low glycemic index means it won't cause your blood sugars to spike.
Mm-hmm. Yeah, the principles that I stick by, because I'm always looking for simplicity, kind of like the circulation thing for food. I'm looking at balance your macronutrients, to stabilize your blood sugar, and don't eat artificial stuff. Like, that's very simplified, but it covers a lot of bases.
Simple works. And then certain people have celiac or gluten intolerance, or they have other sensitivities that then you need to work with, just like with the supplements, then you go talk to an expert and you need a couple of sessions to kind of fine tune it. If we do the DNA genetic testing, we can start to see certain foods also that you may react to, or food sensitivity tests. Right. So it can become individualized. But to start off as the general population, and there is no general person, unfortunately, but the general population, the diet that we put on the website, and I invite you to share that with your clients as well. It's free. We put it up and it's free on our website to download, and it has 21 days of recipes and the theory behind it and why.
So there's the basic nutritional principles that most of us can agree on. And then there are some fringe kinds of things that you hear coming up. Intermittent fasting is one of them. Another one that was new to me, one of my followers just asked about it yesterday, was fast mimic diet. Fasting mimicking diet.
Okay.
So when you hear these things coming up around fasting, intermittent fasting and this fasting mimicking diet, do you have a reaction to?
Well, I think they're fads. In our clinic, we like you not to fast 12 to 14 hours max. So if you go to bed at 8, we'd want you to be eating by 10 a.m. If you went to bed at 8 p.m., if you went to bed at 10 p.m., then we want you to be eating by 12. Some people are doing 16 hours, but 12-hour fast is great. It's good to have a little bit of fast. Fertility, they show a low caloric diet seems to help with fertility. You got to be careful. There are some people that have eating disorders and body dysphoria. So careful with that. Sometimes if somebody has some health conditions, they can benefit from this. What was it? FMD, fasting mimicking
Yeah, it's
diet?
called fast mimicking diet.
Yeah. So that
there's research on that, I guess. The little poking around that I did just briefly was that they're finding some anti-aging
of course,
benefits. It's not complete fasting. You take out a bunch of things, but you still have these few things, and you do it for something like a week.
there's the key. So there's your key. It's a week. So yes, because you're going to give your body a break. So it's a week. It's like people that do the spring cleanse, the gentle detox, right? So yes, because you're going to help your body eliminate toxins. So we do a gentle detox in our clinic, where we give them a special protein powder that has all the nutrients that help the liver do detoxification pathways 1 and 2 at a high dose. And the diet's restricted for 2 weeks. And then the third week we add things back. So that's great. But if you did that for months, you're going to cause problems, right? So the FMD, theoretically, because I haven't looked into it a lot, but if it's a week or 3 weeks, people that are overweight, people that have food addictions and sensitivities, people with psoriasis and bloating, all that, I bet they would feel an improvement because you've taken the load off the body. But if you do this for months and months, you will end up with deficiencies and probably metabolic damage even as well that can have a problem. So it's just like an antibiotic. You may take that antibiotic for that kidney infection, or if you're fighting SIBO, small intestine bacteria, SIBO, you're not on that antibiotic for the rest of your life, right? So it's a course, it's a treatment. So that is that is not a way of eating. That is a therapeutic diet to treat something. And so we do therapeutic diets, but it's medicinal and it's not meant to be done long-term.
I like that framework. This is an intervention. It's not a long-term way of being.
No, it's not your new diet lifestyle. The AcuBalance fertility diet you can eat forever, but FMD is a intervention that you would do for a period of time and maybe do it a couple times a year, but you're not doing that all the time. You will run into most likely health issues down the road and reduce your fertility down the road. But short term, it's an intervention. It probably could help. And then the intermittent fasting, when it's not my expertise, but my Dr. Kaylee McIsaac and our clinic and Dr. Ashley Dammer are naturopathic doctors. And Kaylee and I have had this conversation often. She's kind of like in the 12-hour is kind of her fast. That's what she likes. And she has all the reasons why not. So I think when I talk to her, the sense I get, it's a fad. Is
there a podcast episode with her on this? Or is this just casual conversation you've had with her?
It's casual conversations. I do talk to my team all the time when I see them, but I don't know if she talks about it in her podcast. She talks about the genetic testing and functional medicine testing.
Oh, okay.
And I'm looking right now if my eyes are off the camera, I've pulled up a screen. There it is. She's episode 25. Oh, okay. The episode is called The Real Fertility Diet. Please stand up. So there you go. So we have a
That's what we need. I hope everyone will go check that out if they want to delve in.
And episode 20, she's on twice. So 25 was on fertility diet, and 20 is Leave No Stone Unturned, fertility functional medicine testing, where we go through all the different testing. Yes. So she's on episode 20 and 25, and she might have talked about intermittent fasting in episode 25.
Okay. I had one specific question come in from somebody in my audience. I don't know if this is something you've delved into, but I have. It's about HIIT exercise, high intensity interval training. And I came across all the research on the mitochondrial boosting effects of doing these short intensity, not a lot, but short, no more than 2 to 3 times a week for boosting mitochondrial function. So I've shared that as a possibility for those who are in the phase where they're really working on egg quality, that might be a thing to consider during the time when they're trying to boost egg quality. What are your thoughts on that? Have you seen that research?
Yes. So I haven't seen the research on HIIT, high intensity, what was it?
Interval training.
Interval training. I'll tell you what I know around exercise. So again, I just put it into a framework. So luckily I don't have to read every study, but the framework's nice. How does it affect the soil? Let's dive this into the genetic testing. So remember, I am a methylating, I pour methylation. I'm an inflammatory machine, right? Unfortunately.
Mm.
In it, certain exercise creates inflammation. So I'm the type of person that certain exercise, long, like an hour workout,
Mm.
is going to make me less healthy
Mhm.
because the exercise is inflammatory and I don't have the capacity to deal with all that inflammation. So I'm the type that's supposed to do short burst exercise.
Oh.
Okay. Not this long, hard workout.
Mhm.
So again, we can genetically test now to see kind of where you'd benefit. So there is no one size fits all. I will share, she's going to be on the podcast. We haven't interviewed her yet, but Dr. Geraldine Pryor, who's local in my city, a lot of people know her because the doctor that wrote books on What Your Doctor Won't Tell You About Menopause, and so much of the research on cyclical progesterone and PCOS and in perimenopause is her research. She's an
Mm.
endocrinologist, Geraldine Pryor. And I don't know, we did a talk 15, 20 years ago, maybe. And I remember her talking about exercise, and she sent me all the research back then because she was looking at ovulatory disorders and looking at lifestyle and exercise. And she showed that exercise could interfere with ovulation.
Mhm.
So, and we know when women, I've seen women that are non-ovulatory that are, have real lean body fat, and they lose their cycle, or they have their cycles become very light. And we've tried with herbal acupuncture and we couldn't make a difference. And only by having them increase their caloric intake, which is the opposite, because we know low caloric intake, low, has been good for fertility. But for them, they had to increase it and lower the exercise. And then their cycles came back and they conceived. So there's no one size fits all for this high intensity exercise, but exercise can impact your fertility positively and negatively. And it depends on the body type. Probably if you're thin and dry, you may not do well with that intensity exercise. I don't know. And if you're predisposed like me with inflammation, it may or may not help you. So my response is I don't know. What I do know is it's not good for everybody. And what I do know is it would be good for some, but for some not. And so again, talk to somebody that may have a better knowledge of this, and you experiment. So it was
Yeah.
interesting when I did my genetic testing. When I do cardiovascular, I feel great. When I do squats and resistance training, which is really important, which creates the inflammation, I'm exhausted after.
Mm.
I feel like crap after. Well, now I have a better sense because I have a massive inflammation, which most people can deal with, and I don't deal with well.
And that is such a great example of how it pays to be knowledgeable about these things and then be knowledgeable about your own body
Yeah.
and
How do you feel?
customize it and work with people who can help you customize it. And
Mm.
that's a lot of what you're doing in your clinic. And that's what there are so many providers around that are doing. So I want to kind of tie all this together. I didn't get to all of the pieces about the run of the mill stuff, but we can lump it all together like the stress reduction, emotional healing, massage and body work, energy work, hypnotherapy, meditations, yoga, all these different mind body modalities to bring the stress response down and put us into the, what did you say, the feed and breed mode?
The
Breed,
parasympathetic is the rest and digest, and breed and feed nervous
breed
system.
and feed. Okay. Rest and digest, breed and feed.
Mhm.
I look at all of these different mind body modalities as helping us move in that direction. And how
That's exactly.
significant do you feel that is when you look at your practice and everybody's coming in with their suitcase of supplements and they're coming in for light therapy and all these different things? How much do you feel like the whole environment, how much is the stress level impacting ultimately their success in their
Yeah, I think
fertility?
it's the make it or break it in this day and age. If somebody said, if I only had one tool, what would I use? I'd want to just work with my conscious on the mind level. The brain is the greatest pharmacy. People just want to be happy. That's why they want children. They think it's going to make them happy. And so whether they have children or not, if they're at peace and happy, I consider that successful. And if they're out of a state of alarm and they feel safe subconsciously in their body, the body will thrive
Mm,
most of the time. And if they're, you take a supplement, you eat this meal, you have your laser treatment 2 or 3 times a week, but 24/7, your head is spinning. Um, I don't know if we can counterbalance those negative thoughts, those negative feelings. And at the end of the day, people that have these subconscious programs, I don't deserve to have it, or I'm not good enough, I'm not safe. The baby will temporarily give them excitement. They get, they're pregnant, so they have all the attention. So they're the queen, the attention. Then they have the baby. Then they realize everybody's talking about the baby, not them. For some, that's really difficult because they're no longer the center of the attention, but they love it because now they're a mother, and that's all temporary. And then the baby turns 1 or 2, and then they're back into their shit, their programs, and they're not happy anymore. So at the end of the day, when we heal our hearts and minds, you can be at peace even in a happy situation, meaning you can be at peace. And the unhappy situation is maybe a relationship, maybe work, maybe you don't have a child that you'd still desire, but there's a sense of peace. It's not over
mm,
consuming you. And therefore, you're not in a state of alarm. So you're not creating all this inflammation, hormonal imbalance. So you can be at peace and in an unhappy situation.
mm.
And and that's what this work's about. So the short answer is, I personally think, because from my own personal experience, using this for myself, I walk the talk, and seeing this with my patients, sometimes miracles happen when we do the conscious work. Like on paper, they should not get pregnant. Like it makes no sense. It's a miracle. Um, and I want to get better at, so I can replicate this with so many people. But I've seen it in some cases, like it just blows my mind. But regardless, the people that I get to facilitate and they have that shift and their programming changes, they just have this sense of not stress. They're not like tense and stress and that desperate need that this has to work. They still want it. So the desire's there. They're enjoying the treatments rather than I need to have the treatment. I don't want to miss out on the treatment. They're
Mm.
enjoying the diet. They're just in flow, and they're doing the things that are going to help them get successful or get lucky, and they're living their lives,
Yes.
and they're happy. So they're happy, and then like attracts like. Other things start to flow in their lives. Other synchronicities start to happen. Sometimes that's a baby. Sometimes it's something else that just keeps giving them other reasons to be grateful for. So at the end of the day, we all want to be happy, and so that's why I like the mind body work, conscious work, and your brain is the greatest pharmacy in the world. All these like hormones and chemicals that we release, and so um, mind body work I think is key, and then it trickles down to the body, so top down.
There's so much richness in what you just shared. So many things I want to respond to. I'm going to go right to one that you said that I just don't think is talked about very much. But I think that people often get caught in the notion that getting pregnant and having the baby is going to fix my life. It's going to make me happy. It's going to be the solution. And then that creates this desperation. If I can't get there, then I can't be okay. And like you're pointing out, if you're starting with that framework, even when you get the pot of gold at the end of the rainbow, you find out wherever you go, there you are. And you still have to work through that stuff. So postpartum is you don't ride off into the sunset. Parenting, you don't ride off into the sunset. Oh boy, if you
Yeah.
thought things were challenging before, it's just you can reach new levels of challenging, right? So I believe that this is kind of embedded into the way we've named our programs. Fertility from the Soul
Mm.
is about doing the soul work. And maybe you're motivated by and inspired by your desire for a child and to grow your family. And your Conscious Fertility podcast is about bringing this stuff out of the subconscious and being aware, knowledgeable, conscious about your whole person, your deeper desires, your inner conflicts. There's so much there that you alluded to earlier on. We bunny hop over so many of these emotional and human issues and dive right into how can we work on the body. And
Right.
we opened our conversation really delving into this constellation of innovative technologies. And partly I lead with that because I know people in our audience are inclined to be hungry for that. Like, what's the new thing? What's going to
Mhm.
fix this? What can I go, you know, shiny object, shiny object. And we've both delved into those too. You've gone very deeply into some of these realms, and there's promise there. There's exciting innovation. We're seeing some data coming out that's really exciting, and we want to give everybody every chance that they can have. And at the same time, you said something that really stood out to me when I asked you about the impact of the stress management piece. And you said, that's the make it or break it. Whereas all the other technology stuff, you said, we hope it will help. Some of it, nah, we can't quite ethically say, spend your money on that. Some of it we're excited about. But when we came to the mind body piece and the stress management, he said, well, that's the make it or break it. And I just want to highlight like how much energy and attention we might put toward the novel things versus the things that are pretty, you know, well established. Yet the struggle is it's not something that you can drink or eat or take in a pill. Stress reduction is a journey. That's the soul work, right?
I often say it's simple, but not easy. Simple, anybody can do it. Not easy, otherwise everybody would do it. But to the real to put it into a framework or to put it into our reality, like into this world that we're living in for the individuals listening, this desperation desire, they didn't choose. So they have a desire, they have a desperation. So they didn't choose it. So when you're in the storm, it's hard to see what we're talking about. Like, oh, do the mind body. They're desperately wanting this child. And it's that over attached to form an outcome in conscious circles that creates resistance. And you talk a lot about circulation flow. So when you put resistance into the system, the body, or into the field, if you want to talk quantum, spirituality, um, then you block flow and receptivity. And fertility requires flow and receptivity. And so, but you didn't choose this desire because you don't choose whether you like chocolate ice cream or strawberry ice cream. You just like it. And then you say, I like chocolate or I like strawberry, right? So we're not choosing our desires. We just notice these are our desires. And then when we become overly attached, they become desperate. So desires probably are okay. Like I have patients that I'm seeing that desire the child, but they come to a place they're okay either way. They know they may be disappointed, but they've developed tools through our work that they have the emotional resilience to work through whatever life's going to throw at them. The fertility is the wake-up call. And so it brings people to people like you and people like me. And I get they're coming. There's no judgment. They're coming because they're hoping this little bit of mind-body work may be the thing that's going to tip the scale so they have a baby.
Mhm.
And I know that I can't decide. I don't know who decides whether this person has a baby or not. I don't know exactly how the universe works. But I know that these tools in rewiring the subconscious and changing your traits, can get to a place that regardless of what happens, you're going to be okay.
Mm.
And so fertility is our wake-up call. So there's this understanding that we know, whether it's said or unsaid, that they're coming to me and they know I believe in there's a fertility wake-up call, and I want you to have this spiritual awakening that will help you heal and heal the planet. And I know that if they weren't trying to get pregnant, they wouldn't be coming for the mind body work. They're coming for the mind body work because they think it's one more thing that may help them. The beautiful thing is while they're doing this, because they're desperately wanting this child and they didn't choose this. So I understand why they're desperately wanting this child. And they do the work to heal their mind and heart so they can get pregnant, a shift happens.
Yeah.
So we both succeed in our hidden agendas.
Yeah.
The shift happens, and then all is good. But the fertility is a wake up call. So in my practice, I'm known for fertility and with the conscious work, but I see people that aren't trying to grow their family that have terminal illness, that have a divorce or think they want to be in a relationship or they need a different job or more money. And at the end of the day, they just want to be happy. And so
Mhm.
we use these tools to help them tap into their inner healer, to their soul. And they're just tools. So that just like I do with the body stuff, I give them information, I give them tools so they don't need me after so
Mhm.
many sessions. They can do it on their own from the mind body part, at least. Unless they buy their own Giga or a good laser system, maybe they need to see me a bit. But some of them are buying some pretty good home systems as well that I teach them how to use. So I guess we're in alignment to that. But I want to share for the listener, you didn't choose the desperation. And I'm not saying don't be desperate. I'm saying I get you're desperate. What we're both sharing, Natalie, is that this desperation actually, though, is putting resistance into the field. It's an impediment, and it's going to slow down your chances to pregnancy.
Mhm.
So we want to help you lower the resistance so you have that circulation, that free flow and receptivity. Um, and we have tools for that. But
Yeah, we're very much aligned on that. I don't judge any of these feelings and desires in any negative way. As you know, I can relate to this. This is what
yeah,
led me to this
you
work.
lived
I
it.
was in that extreme desperation place myself.
You get it.
And I believe that all emotions are there for a reason and they can all be useful to us. And the desperation is the carrot on the stick that drives us to wake up every morning and say, what can I do to bring a better result? How can I
Yeah.
feel better? How can I do better? And in fact, when sometimes people come into my program and immediately get pregnant, I'm thrilled for them. I'm also disappointed because now the carrot is not on the stick and they don't have the motivation to do the soul work that I wanted to teach them. I,
Well,
I lose them a little bit. They're like, oh, so fast, so fast. You didn't
yeah,
get to do the
the
program.
soul, it will come. The soul if the soul wants to
Yeah,
heal,
it'll come.
it'll
But I
show
missed
up.
that window. So if they get to be in for 3 to 6 months and really absorb the juicy stuff, then I know they're
Yeah.
going to take it with them for the rest of their lives.
Yeah.
Um, but
Well,
yeah, the desperation is it can be a barrier, but it can be the motivation. And ultimately, I want to see that desperation transform to where we're not motivated by our pain and trying to solve the pain, but we're motivated by love and desire and hope and joy, that those things are pulling us forward
sure. Well,
from an
pain,
expansive
mo-
place.
pain moves us, and the Buddhists say, from suffering comes awakening. So it's
Mm,
unfortunate, and many people have their wake up call different ways. Some is trying to grow their family. Some, like we talked about, terminal illness, death in the family, divorce. At the end of the day, though, I believe the inner work, the inner transformation that you share, and I do in my practice. I find important. You've used it for yourself. I still use it for myself, and it may be something that can help people on their fertility journey. And regardless, I don't see a downside because, who doesn't want to just have that sense of peace and feeling happy?
absolutely. This has been such, I don't know, a master class in I'm thinking about the system, the whole picture, balancing the yin and the yang and the Western and the Eastern and the technology and the basics. This has been really soul nourishing for me to get to have this conversation with you. I can't wait to hear feedback from our audience, how they respond to this. I hope people will leave questions and comments in the comments below this video and share it widely. And please tell us how people can follow you, how they can learn from you.
So
Be
the
awesome.
AccuBalance.ca is the fertility diet. So please download that. And then we're on Instagram. I have the Conscious Fertility Podcast on Instagram and Facebook. And I have Lorne Brown Official is my Instagram page. So those are ways to kind of follow or find me. But I think if you go to the Conscious Fertility Podcast and the AccuBalance website, there's some resources for you. If you subscribe to the podcast, it will notify you when we release an episode. We do them sometimes weekly, usually every 2 weeks. And to remind everybody that Natalie's on there, episode 82, I believe. So check out her episode because I thought it was wonderful. I loved what you shared in that episode. And there's just so many guests on there that I love to interview and learn from. So AccuBalance.ca and Conscious Fertility Podcast, they're on Facebook and Instagram. They're the best ways to communicate or find other resources available to you.
Fantastic. And I will vouch for that your Conscious Fertility podcast is binge worthy. So just cue that up, listen on the road. That's what I've been doing. I love it. I'm
Thank you.
so glad that you're curating these conversations to share with the world. It's a wonderful, wonderful resource. So thank you so much for so generously sharing your time with us here today.
I enjoyed it. This was it was good to do this with you, and I can't wait for you to post it, to share it as a resource as well to others. So thanks.
Yeah, I have a
Thanks for
feeling
picking my brain.
yeah, this may be the beginning of more conversations. All right.
Absolutely.
Thank you so much for your time.
Thanks.